23rd June. So when this was presented to the United Nations at their council, they resolved that instead of having another day designated as the International Public Service Day, let's benchmark what Africa has decided. Africa decided that we should be celebrating public officers on this day. And subsequently, the resolution was picked in December 2002. And we had 23rd June designated as the Public Service Day, International Public Service Day. And I think when we look back from where we've come, many of us have been in the service for a while. We have had a number of challenges. We have had a number of celebrations. We have sustained this country in a number of ways, because I think the country survives on the public sector and public services. So it is important that at the end of each year, we do come to celebrate as public servants, as a public service, and celebrate our service. It is a celebration of the values of self-service, the spirit of service. We hold office in public trust. So it is a celebration that we sustain our countries, we sustain our institutions all year round. There are a number of things that may not be going right. There are a number of things that may be quite challenging. Actually, the times we are living in right now are quite challenging. They bring on board new dimensions of how we operate. So many questions are coming through. How do we move going forward? We have already found grounding. That is why, for instance, we are able to celebrate this day in a virtual manner. Probably if we hadn't found our grounding, we would be saying we can't celebrate this until the COVID pandemic comes to an end. But we have noted that we must fall in line and we must be pragmatic and work with the times. So here we are. It's a celebration of value and virtue of service to the community, recognizing that the public services that we offer are critical in the development process, and recognizing that it is the work of the public service that sustains the nations worldwide. So I think it is a celebration that we should applaud ourselves for as we go through the day. We should be starting any minute from now. We will be waiting for the guidance of our Permanent Secretary, Ministry of Public Service, because also we need to have our minister on board. So once we have our minister on board, we should be starting shortly. But for now, I quickly want to let you know that we will have the official opening. We will have the formalities that come with that. We will have anthems. We'll have a prayer, we'll have a welcome note from our Permanent Secretary, and who will be representing the head of the public service as well. So we will hear from the head of public service, and that will be presented by our Permanent Secretary, Ministry of Public Service. And then we will have the official opening remarks from our Honorable Minister of State for Public Service. That will lead us into having our keynote address, which will be presented by none other than Dr. John Mary Kauzia from the United Nations Department of Economic and Social Affairs, UNDESA. And after that, we'll go into a roundtable engagement where we will have a quick presentation on the status of the human resource in the Uganda Public Service. On such a day, it is pertinent that we get a feel of what the public service looks like. The public service is driven by human resource. It's driven by people. It's driven by us. So it is important that we get a feel of where we are in terms of our numbers, in terms of what we've been able to do, in terms of what the times dictate for us as the drivers of our development, as the drivers of the state and social services, and what the future holds for us. So we will be looking at that. We will also have a presentation coming in from the private sector. Ladies and gentlemen, at the times we live in, the aspect of partnerships is very critical. So we have engaged the private sector. They will be with us. It is important for us to know what do they expect of us, and probably also share what we expect of them as the private sector. How do we support one another during this time and going forward? Because the dictates of this time also have a lot of implications of what we do for the future and how we sustain our services. We are not able to have NPA with us, National Planning Authority, but that is okay. We will be proceeding with the rest of the program as shall be displayed. Then we will move into the key sectors, select sectors that we have identified. That is service delivery in the key sectors of education, health, and the local government. Ladies and gentlemen, you know that at the local government is where service delivery is, but we have key drivers, key sectors. So we will be hearing from education sector, the health sector, and the local government sector. What is it that they have been undertaking? What are the challenges they are facing? What have they been able to do? And what is it that they are planning to see us sustained and supporting those services to the public? So that is what we are going to be running through for the day. Ladies and gentlemen, once again, you're most welcome to this celebration of the Africa Public Service Day for 2020 with the theme of On the Front Lines, honoring public servants in the COVID-19 pandemic response. We do want to focus on the period or the times of the pandemic, but we want to say that there is a future beyond the pandemic. So our focus during the interaction of the day will be quite futuristic on how we look forward beyond the pandemic. So you're all most welcome. I will be back shortly. Let me first get guidance from our team.
Yes. Thank you very much, Savia. We can start. Good morning, everyone. Savia, let's start.
Okay, thank you very much, Madam Permanent Secretary, Ministry of Public Service. Ladies and gentlemen, according to our program, we will start with the anthems, that is the Uganda National Anthem and the East African Anthem, but we will play one stanza of each. So wherever you are, please, you will need to stand up and we have the anthems, and after that, we will have a prayer. So let's start with the anthems, ladies and gentlemen. Patrick, if you're there, let's have the anthems, please. Gentlemen, I think we will do the ever ready. Hello? Okay, ladies and gentlemen, we are going to have to sing the anthem. We are going to be your vocalists, so we are going to lead you in the anthem and we will sing one stanza of each.
twaomba uilinde Jumuiya Afrika Mashariki, tuwezeshe kuishi kwa amani, tutimize na yetu. Jumuiya yetu sote tuilinde, tuimarike, umoja wetu ni nguzo yetu, idumu jumuiya yetu. Uzalendo pia mshikamano viwe msingi wa umoja wetu, na tulinde uhuru na amani, mila zetu na desturi zetu. Jumuiya yetu sote tuilinde, tuajibike, tuimarike, umoja wetu ni nguzo yetu, idumu jumuiya yetu.
Ladies and gentlemen, let's humble ourselves from a prayer, and the prayer is going to be led by Mr. Kenneth Yatim. Kenneth, yeah.
Let us pray. Almighty God, we thank you for the gift of life. We thank you for this beautiful day, and we thank you for everyone who has been able to attend this virtual celebration. We commit the 3 hours into your hands and ask that, Lord, you will be with us, that you will keep us healthy and strong and inspire us. And as we listen to the keynote addresses and the various speakers, we pray that, Lord God, you will teach us and that you help us to be able to appreciate every single public officer in their various places and the work that they do, and that they may continue to serve you and serve this nation. We thank you once again. We pray all this in your name. Amen.
Thank you very much, Kenneth. Ladies and gentlemen, once again, I want to welcome you to this celebration of the Africa Public Service Day. Our Honorable Minister, State for Public Service, Honorable David Karubanga, our representative for the Head of Public Service and Permanent Secretary, Minister of Public Service, Madam Catherine Musingwire, our keynote speaker, the UN representative and Chief of the Department of Economic and Social Affairs, UNDESA, Dr. John Mary Kauzia, our Chief Executive Officers who are with us here, Chief Executives, heads of agencies, heads of ministries, departments, agencies, and local governments, our directors who are with us this morning, heads of departments that are with us this morning, all you distinguished public officers in your respective capacities, we want to welcome you to this celebration of the Africa Public Service Day 2020, which we are celebrating on the 30th of June, 2020. We are celebrating this day under the theme On the Front Lines, honoring public servants in the COVID-19 pandemic response. We want to welcome you to this celebration, the first of its kind, and an indication that we are responding to the times. You're most welcome. And without further ado, I want to take this opportunity to welcome the Permanent Secretary, Ministry of Public Service, to welcome us all, and also give the remarks of the Head of Public Service, and after which she will invite our Honorable Minister of State for Public Service to give his opening remarks, and then we shall proceed with the program for the day. Madam PS and representing Head of Public Service, you're most welcome. Thank you, ladies and gentlemen. You're most welcome.
Okay. Thank you very much, Commissioner Civil Service College, Madam Savia Mugwanya. I first of all bring apologies from the head of public service, who has not been able to be with us because of other duties. His deputy is on leave, and so he could not make it. The Honorable Minister of State for Public Service, permanent secretaries, the Chief Public Service Innovation Branch, Division for Public Institutions and Digital Government, UNDESA, the Executive Director of Public Sector Foundation, Chief Administrative Officers, senior officials of government and agencies, all staff of the Ministry of Public Service, distinguished speakers, the media. I warmly welcome you to today's virtual celebration of Africa Public Service Day. I thank you all for taking time off your busy schedules for this very important event, which recognizes the contribution of public servants in development. We are also extremely privileged and honored to have present with us our very own Dr. John Mary Kauzia, who is Chief in the UN, and his lovely spouse, who is also in attendance. This means that our celebration has been graced by the UN, and we are really grateful and appreciative. Our theme for this year's celebration is On the Front Lines, honoring public servants in the COVID-19 pandemic response. It is a very important theme because this year has been totally different from several years. And in the context of the public servant, it has put us in a state which we have never experienced before. I will not go into the detail of the history of the inauguration of the Public Service Day because it has very well been ably elaborated. This year's celebration was dedicated to all women and men who risk their lives and health amidst the COVID-19 pandemic. And it is a point of recognition for all these brave and hard workers who are still working for the essential public services amidst the ongoing COVID-19 pandemic, not only in the world, but in Uganda as well. This has included people working in the healthcare sectors, sanitation, education, transport, law enforcement, and all public servants who have continued to work amidst the pandemic while others have been sheltered in their homes. In Uganda, we chose to invite all public servants to participate in this virtual event due to the COVID-19 pandemic and encourage all institutions to commemorate the day through events at institutional level. We'll appreciate that the global community is racing to slow down and eventually halt the spread of the disease, which has claimed thousands of lives and sickened thousands of others. According to the World Health Report on tracking the pandemic in Africa, the virus has spread to dozens of countries within weeks. And as of yesterday, 29th of June, it had affected over 285,000 lives, with Uganda contributing to 833 cases. Fortunately, God has been with us, that we have not reported any deaths. And we believe this surely should be intervention from above. We thank God for that. Governments and health authorities across the continent are striving to limit widespread infections and have instituted a number of measures. In addition to the health implications and loss of life, the pandemic has strained healthcare systems, disrupted the education system, wreaked havoc on businesses and economies, led to unemployment and disrupted social life due to the lockdowns, curfews, and other stringent measures aimed at containing the virus. All this has happened in the context of implementing the 2030 Agenda for Sustainable Development, where the public service and the public servants are critical. In spite of all these disruptions by the pandemic, we must not lose focus of the key service delivery role that the public service plays in development in attaining the 2030 agenda. The abrupt and brutal disruption has thrown the public service and public servants into a frenzy, forcing them not only to deal with fighting its spread, but trying to manage its accompanying socio-economic fallout. It has catapulted public servants into the front lines in the response to the crisis without any prior preparation, forcing them to quickly deal with a changing and ever-changing situation and improvise along the way. Today, the humble public servant is in the spotlight, and the public is expecting services as usual and the best of excellence, because many of the resources that nations have been channeled towards service delivery, towards essential services, while others have had to stand aside. So it is at a very critical point that the public servant must show cause why he is where he should be, why the budgets are skewed towards supporting service delivery, towards maintaining his pay, and towards service delivery. Public servants are working under life-threatening circumstances, and they are in insufficient numbers. In Uganda, we know that many of our institutions do not have staffing levels beyond 67%, most especially in the local governments. And we'll hear about those statistics later. There are many roles that public servants have played and are playing and must continue to play. By threatening disruption of public service delivery, the COVID-19 pandemic touched a cardinal principle of public service, and that is of continuity. We are all aware that government must continue serving, regardless of what happens. But this has been greatly threatened. Fortunately, as Uganda, we have picked up the pieces very fast. Even when we had a skeleton staff, we reorganized ourselves at a short notice and continued services. As I speak, the latest directive is on maintaining only 30% of the workforce at the workplace in order to ensure that there is no congestion and that the health risks are reduced. With the institution of new standard operating procedures to prevent the disease, the services that we have been delivering and the interaction with our clients has really had an upheaval, because many of our clients who do not necessarily have access to the IT infrastructure were used to moving physically to interface with public servants. But now this is not the case. We have had disruptions to our universities, to our schools. Teachers and education professionals have also been disrupted. But however, we have quickly rushed to provide home learning using television, using radio, and I believe more is yet to come. According to the OECD report, at almost overnight, workplaces have been transformed in the public sector, and we have had to face a new work ethos. In this regard, the onus is on the public sector workforces to quickly adopt to work in new ways and new contexts. Line ministries and agencies are right now learning how to use new technology and tools which are versatile alongside the old procedures and processes. Individual public servants are adopting work and personal time to meet family and caring commitments. Incidentally, the public sector has become accidentally agile, so to speak, with new procedures and protocols such as remote working. That said, we need to focus. So what next? In the post-pandemic government, there will be a need to reposition ourselves to review and capitalize on the many changes that have been introduced, and most definitely develop policies that will sustain the use of these new work methods so that we are not caught in a web of operating in an ad hoc mode. In the midterm, the focus of government is on how to ensure that public employees are able to work safely and resume non-pandemic related service delivery. It is also critical that we adopt best practice in the public service to ensure that citizens of Uganda are better served. That equity is promoted by ensuring access to services, particularly by the vulnerable groups. Critical to this is timeliness and courtesy, transparency in decision-making, professionalism, and accountability. As my parting shot, I wish to emphasize that we all embrace new public administration work ethos and rise up to the demand of more dynamic work methodologies that are a radical departure from the norm, producing excellence both in terms of cost and efficiency to improve service delivery. We will also need to re-engineer work processes so that we reduce, most especially time, reduce social distance, increase social distance and increase accountability to the public at all levels of society for attainment of national development goals. With these remarks, I hope we'll all benefit from today's discussions, and I thank you for listening to me. I therefore take the honor and privilege of inviting the Honorable Minister of State to address you. Thank you for listening to me, for God and my country.
Thank you, PS, for that presentation. Head of Service and Secretary to Cabinet, who has been represented by none other than the PS Minister of Public Service, the permanent secretaries available, the chief administrative officers, senior officials of government, Dr. John Mary Kauzia from Undesa, all the way from New York, all staff of the Ministry of Public Service, distinguished speakers, members of the press, all Ugandans online and live on all other media platforms. I welcome you all to the 9th Africa Public Service Day virtual commemoration. Indeed, doing work through virtual platforms has become the new normal because of the COVID-19 pandemic. The theme for this year's commemoration is on the front lines, honoring public servants in the COVID-19 pandemic response. I take the opportunity to thank all public servants that have led and continue to lead the front line against the prevailing global COVID-19 pandemic in Africa in general and Uganda in particular. I thank His Excellency the President for his steadfast leadership, which has enabled us through the stringent measures he has put in place, fight the pandemic, and this has been exemplified by the slow infection rates in our country, Uganda. And I'm glad to say that we don't have any single death so far. The Ministry of Health, of course, and the entire health sector have done a commendable job to keep the country safe, informed, and updated on the efforts to mitigate the spread of the virus in our country. However, the health sector couldn't have succeeded without cooperation and support from other arms of government, like the legislature, ministries, departments, agencies, and local governments. The Parliament of Uganda played its part by appropriating the required resources to empower the frontline public servants to execute their job efficiently and effectively. The security sector has done well to enforce the lockdown guidelines and the social distancing protocols issued by the government since 30th of March, when the lockdown was implemented. The outbreak of COVID-19 pandemic has affected the entire world, and indeed the pandemic has led to more than 500,000 deaths globally, broken down health systems, disrupted livelihoods, and brought the education sector to a standstill. Businesses have been wound up, employees have been laid off, airlines have been grounded, tourism has been curtailed due to lockdowns, curfews, and other stringent measures aimed at containing the virus globally. Implementing the lockdown requirements therefore needs existence of an effective state and government machinery to manage the situation, but above all, to ensure continuity to delivery of public services. I have to apologize for the small glitch of covering the camera, the webcam. I'm glad to say that public service has acquitted itself very well in this regard. So public servants have continued to work at the risk of their own lives. Indeed, you know that our healthcare workers have continued to work, and many of them have been infected, but they have not relented. I commend public servants, institutions for innovating new ways and methods of work that have helped to deliver services to the public. Digitization of service delivery had never been so urgent and high on the agenda, but now we realize that it is something we have to really prioritize. I encourage you all to be more innovative. The role of the public service and public servants in the fight against COVID-19 pandemic is to ensure, of course, continuity of public services and service above self, production and dissemination of reliable information to the public, sustaining resilience and responsive public service, strategic thinking and planning in adversity, enhancing legitimacy of the state and building trust within the public. And of course, formulating pro-poor and people-centered policies and providing accountability to the public whom we serve. As the PS has said, we remained with the skeleton staff of 30%, and that was aimed at ensuring that service delivery continues. Lastly, the COVID-19 pandemic has affected us all in other ways that haven't been studied or discussed in the public domain. The requirements of social distancing and curtailing convergence of crowds are no doubt very essential to mitigate the infection rate and spread of the virus. However, it takes the synergies of togetherness and teamwork as people become self-centered and individualistic. Whoever catches the disease is isolated from the public and indeed treated. This has played out globally as states closed their borders and airspaces to the outside world. Apart from the World Health Organization, there has been no cooperation in the fight against the pandemic, despite the existence of very many regional economic and political blocs all over the world. And indeed, every state has been doing it their own way and without the cooperation of the other. The East African community should have had a unified response and approach to the fight against the pandemic. The thorny issue of truck drivers in the region should have been tackled in a concerted and collective regional framework under the East African community. May the good Lord rest all the souls of those who have died from the coronavirus in eternal peace. I thank you all for being available for this virtual opening ceremony. Thank you.
Thank you very much, our Honorable Minister, for those welcome remarks. Thank you, the representative of the Head of Public Service and the Permanent Secretary Minister of Public Service for those remarks. Ladies and gentlemen, we have all been welcomed, but key to note in the remarks that have been made, first of all, the resilience that we have shown has been appreciated, but most specifically for the frontline workers and all of us. I think our being here today is a clear indication that we are resilient and are falling in line with the demands of the times that we live in. You have heard very well that our repositioning of the service is going to be important to be quite responsive, dynamic and responsive, giving services that are still excellent in time and equitable to all, taking into account the vulnerable, making sure that we prioritize service delivery to the vulnerable persons in our communities. We have been reminded that business definitely cannot be as usual, so we will have to do some re-engineering of our work processes. And we have been reminded that it takes collaboration for us to be able to work through all the demands that are coming with the new times. Ladies and gentlemen, I still want to take this opportunity to welcome you once again. I want in a special way to recognize that we also have the Executive Director from Socio-Economic Development. He's with us. I also want to take note of Mrs. Francois Risa Kauzia. Madam, you're most welcome. We want to also welcome one of our senior officers from the Uganda Bureau of Statistics, Mr. Edgar Pamizi. We want to welcome one of our senior officers from Gulu District Administration. He is also with us. So as the names come through, we will let you know who we have with us. But ladies and gentlemen, all of you are most welcome. Without further ado, I am now going to carry us to the next session of our program, which is our keynote address. Our keynote address is going to be given to us by none other than Dr. John Mary Kauzia from the United Nations Department of Economic and Social Affairs. Ladies and gentlemen, for all of you that had probably not joined us, the one thing I noted that this day actually is special, and it would be important for us to honor the public servants, not only the ones that have stood up for us at the front line in the times of COVID, but those that have served helplessly. And we have a living example this morning in the representation of our keynote speaker, Dr. John Mary Kauzia. I noted to you that where he lives, he should actually be in his bed. He should be doing the final bits of his sleep. Dr. Kauzia, I don't know whether I should apologize that we didn't take the time variation into account this time round when we were calling you. But I think the theme for which we are celebrating service above self, the resilience and commitment is what you have exhibited. You could have easily told us that, excuse me, that time is not for me to be up, but you said, yes, you will join us. And we want to applaud you for that. So if there was a virtual hand clap, we'll probably give it, but I think we definitely applaud your service to us. Ladies and gentlemen, allow me to briefly introduce to you Dr. John Mary Kauzia, who is currently the Chief of Public Service Innovation Branch. at the Division for Public Institutions and Digital Government in the Department of Economic and Social Affairs at the United Nations headquarters in New York. And he has been there since July 1999. Prior to taking up that role, Dr. John Mary Kauzia worked as an interregional advisor in governance institutions and systems in the same division. But previously, he had taught back home in Makerere University, and he had also worked as a deputy director for the Uganda Management Institute. He was also an international advisor in Africa in the various fields of governance and public administration and management, which included, among others, many, included management training, consultancy, strategic planning, as well as high-level public sector leadership capacity building. He has also advised a number of our African governments with respect to governance and public administration in the areas of civil service reform, decentralization, management of local governments, capacity building for conflict management, parliamentary restructuring, strategic development planning, public policy design, programming and evaluation, as well as strengthening capacities of institutes and schools of public administration. That advice he has given to several countries, Uganda inclusive, Rwanda, Ethiopia, Mozambique, Angola, Somalia, South Africa, Tanzania, Liberia, Kenya, Comoros, Kosovo, Guinea, Conakry, Togo, and Brazil. So when we talk about a representation of a whole of the globe perspective in service delivery, Dr. John Mary Kauzia exhibits that. He holds a PhD in law, a doctorate from the University of Paris, and he also majored in public administration and management. He has a bachelor's degree which was obtained from Makerere University in Uganda, and postgraduate studies in various institutions, such as the University of Grenoble in France, Liverpool Institute of Public Administration and Management in the United Kingdom, the International Institute of Public Administration in France, and the Administrative Staff College of Nigeria. Dr. Kauzia is fluent in English and French, and he is a member of the Commission on International Accreditation of Public Administration, Education and Training Programs. He has also served as a member of the UNDESA, Asia International Task Force on Standards of Excellence in Public Administration, Education and Training. He is working currently and supporting the Africa Public Sector Human Resource Managers Network. He is very supportive to that young network, and he is also supportive to the African Association for Public Administration and Management, APAM, in ensuring that they professionalize the management of human resources in the public service of Africa. He is also a member of the advisory board of Public Money and Management, Integrating Theory and Practice in Public Finance and Management, which is an independent international review of finance management and policy in the public service of the Chartered Institute of Public Finance and Accounting. Dr. John Mary Kauzia was awarded, he was recognized for his works and in public administration and public policies, and he was awarded with an O.P. Dwivedi Award in 2014. O.P. Dwivedi is a born of India, but who settled in Canada. He was a professor emeritus of political science and public administration, who was honored in Canada. He was given one of the highest honors in Canada because of his works, and subsequently an award was inaugurated, and the people who win that award are actually awarded because of their special works in supporting public administration and public policy internationally. And this was given to him by the International Association of Schools and Institutes of Administration, IASIA, for outstanding contribution to public administration and public policy in the world. He has published in a number of areas of governance and public administration, and definitely his works continue. Ladies and gentlemen, that is Dr. John Mary Kauzia, who has the global perspective to a number of things. And today he is giving us the perspective of business continuity in terms of the global response to the pandemic. How is business continuity response to the post-COVID-19 being handled at the global level? So let us, ladies and gentlemen, unmute our microphones and give Dr. John Mary Kauzia a round of applause in welcoming him to take us through the keynote address that he has prepared for us. Dr. John Mary Kauzia, you're most welcome, and this hand clap is for you. Thank you very much, and you may now. Doctor, we can't hear you. If you can unmute your microphone, please.
Is it okay now?
Yes, you're loud and clear. Thank you.
Good. So thank you very much for that extended introduction. Honorable David Karwanga, Minister of State for Public Service, Mrs. Catherine Musingwire, PS Public Service, also representing the head of the public service, all permanent secretaries who have joined us, and all public servants who are with us. I'm very happy and privileged to be able to join you in this celebration for two reasons. First of all, because I'm a Ugandan. Second, even if I abandoned my job, I was recruited in the Ministry of Public Service. I will never forget that. I still have my appointment letter. That was the first job I got after my first degree. So I'm happy to join the Ministry of Public Service. But probably most importantly, you are celebrating the Africa Public Service Day. And as Chief of Public Service Innovation Branch here at the United Nations headquarters, the bigger part of my job is actually to supervise and organize the United Nations Public Service Day celebrations, but the United Nations Public Service Awards competition, and the annual United Nations Public Service Forum, which this year would have been held in Korea, but was interrupted by the COVID-19 pandemic. And I'm happy to note that every year I've been meeting Ugandan leaders in this forum. But this year, despite the pandemic, you have managed still to organize this celebration. So thank you very much. I'm going to try and make the best that I can out of the theme that I looked at and wondered what I would say. Let's see whether I can manage to do the. That's the plan of my presentation. I have roughly 9 things to talk to you about. The first one is really in form of a question, because I was requested to talk about the business process continuity, and I wondered what business. And I will end by talking about the competences and mindsets that individual public servants exhibit, especially in situations of pandemics like this one and crisis. First of all, we need to remind ourselves that the biggest job the world had undertaken since January 2016 was the implementation of the 23rd Agenda for Sustainable Development and the determination to achieve the 17 Sustainable Development Goals. Coincidentally, in September last year, world leaders gathered in New York to review what so far had been done in this respect, and they noted that there was a risk of the world missing the target of meeting these 17 goals by the year 2030, and they recommitted their energies and promised to put as much resources as they could harness and make sure and to achieve these goals. But as it turned out, then the COVID-19 hit just 2 months after they had made this commitment and disrupted everything. And it is in this context that we salute all public servants who, despite this brutal disruption, have continued delivering services all over the world. Second, when we are talking about the 23rd Agenda for Sustainable Development, the tendency is to focus on only the 17 Sustainable Development Goals. I want to propose to you that in addition to that, that's obvious, as long as the services are well delivered, the 17 goals will be achieved. But in order to do that, the values and principles that are enshrined in the 23rd Agenda for Sustainable Development have got to be adhered to, applied to the letter. Because in fact, when you look at these values and principles, you realize that if they are adhered to, then most societies would be very good societies. And on this point, I'm saying that the biggest win the ongoing COVID-19 pandemic can score against the world is to take us off the ambitious 23rd Agenda to transform the world into a good society. We should not allow the pandemic to detract us from this noble cause. Now, in terms of Uganda, if I can put back the original page, you probably wondered why I had the Sustainable Development Goals, the Uganda Vision 2040 and the East African Vision 2050, and then the Agenda 2063 of the Africa Union. So in terms of Uganda, implementing the 23rd Agenda for Sustainable Development is actually supposed to be the same as implementing Uganda Vision 2040. If you look at that diagram, you will find that whether it is Uganda Vision 2040 or the East African 2050 Vision or the Africa 2063 Agenda, or indeed the 23rd Agenda for Sustainable Development, which is a global program, these are highly transformational strategies. And I did not forge the word transform, I read them all. And those words I'm using, I picked them from these strategies. Therefore, I think every Ugandan public servant, first of all, needs to be very conversant with the Uganda Vision 2040, because every work is supposed to be geared towards achieving that, but also bearing in mind that Uganda is part of East Africa and part of Africa and definitely part of the world. So these are not separate strategies. This is one strategy that is supposed to be focused at the national level. That's how big that work is. Now, I was requested to talk about how the world is ensuring continuity, business continuity. In this sense, we can stick to the public service. I thought it would not be wise, given the time, to pick every country and try to say this is what they did, this is what I did. No, rather, I tried to see the number of countries and pick out the things that have made them successful or not successful. And therefore, I want us to look at the principles and values which are enshrined in the 23rd Agenda for Sustainable Development, which when implemented can transform a society into a good society. And the only thing that I would want us to learn from this is that these principles actually constitute a social vaccine against the negative impact of pandemics. Because right now, the world is engaged in a battle to find a vaccine against the COVID-19 virus. But you realize that this vaccine, if found, will probably protect individuals. And the question that remains is, how do we protect societies? When you observe what has happened in a number of countries, those that have survived relatively well this pandemic, you realize that they had a social vaccine. That's what I decided to call it, a vaccine that sort of protected their societies from being ravaged by the impact of this pandemic. And I looked at, first of all, these principles and values are enshrined in the 23rd Agenda, which means the global leaders that framed this 23rd Agenda had already seen that in order for societies to be good, they needed to have these principles engraved in their lives. But the pandemic has helped to prove this correct. So societies that have had their policies and strategies, their governance systems focused on the people, if you look at the piece of the 23rd Agenda, those that have fought poverty, those that have achieved prosperity, those that work in an integrated way, those that struggle to leave no one behind in development, those that work in partnership and collaboration, those that ensure inclusiveness and accountability in all public governance activities, those that have reached levels of resilience and they ensure equity in everything they do, those that are innovative and respect diversity and ensure security, peace, and justice, and ensure effectiveness in the implementation of their policies when those policies are good and pro-people. They are the same countries that have managed this pandemic well. So I told myself, I'm not going to pick each country and say, this is what they have done, but the analysis, I think, proves this correct. Now, if you look at that diagram, where you see you in brackets, I was trying to say that exists in Uganda. As the Vision 2040, for example, is aimed at transforming Ugandan society from a peasant society. So that means the notion of transformation is not only in the 2030 agenda, it's also in Uganda. The focus on people, uh, the search for prosperity, the search for peace, that also is in Uganda. Integration, if you read the vision, you will see that that principle is there. I left leaving no one behind because one, I didn't see it, neither in the constitution nor in the vision 2040. But most importantly, when you examine the poverty figures of Uganda, you realize that many people are left behind. And therefore, that's something to ponder. Partnership and collaboration, inclusiveness, and accountability, resilience. I didn't see it in the plans of Uganda, but I think, especially in terms of the public service, I think it has been resilient. But I would invite people to discuss it. To what extent is Uganda's society resilient? Equity, it is visible in plans, and so is respect for diversity, security, peace, and justice, and effectiveness. I leave you to discuss whether the Ugandan governance system is innovative enough. So in other words, if we have to vaccinate our society against the negative impact of future pandemics, because they will be there, we really need to pay attention to these values and principles that can make a good society. And one of the most important ones we need to pay attention to is equity. Now, when you read the plans of Uganda, you don't see very much the word equity. What you see is the word equality. Conceptually, these two are different. I would rather aim at equity than equality. And equity is very easy to disaggregate into different components like social equity, economic equity, intergenerational equity, and ecological equity, which has to do with the way we use our environment. So although when you read the Ugandan constitution and when you read the 2040 vision, you see equality, and the temptation is to say, okay, that means they are aiming at equity. I think we need to realize that's not the same thing. And countries that are putting emphasis on equity, they have done well on this, because what it means, their elderly didn't die, their poor didn't die. If I can be a little bit and diplomatic and give you an example of what is happening here in the country where I am, the elderly died a lot, and the poor people are dying a lot because of this pandemic. Now that's because there is no equity. Countries which had equity in their social programs did not have this discriminatory death. The other important value that I think many countries have paid attention to, and they have reaped the dividend as illustrated by the way they have managed this pandemic, is that value of resilience. And I think the lesson we can learn from this is that we use the misfortunes of the pandemic to do better, to bounce forward and build better. Because, you know, many people take resilience to mean bouncing back. Okay, it's good if you bounce back, but if you bounce back, another pandemic will come and push you again out. So what you need is to have a strategy for bouncing forward and building a better system that can withstand any other pandemic. Because as I said, this is not the last one, there will be others. And such a system, whether you are talking of public sector institutions like the public service or private sector institutions or civil society or the society as a whole, there needs to be capability to absorb shocks, to adapt to new, better ways, to anticipate problems, to do sustained research for better ways, to communicate among the various actors rather than working in isolation, to ensure coordination, integration, and collaboration and partnerships, and certainly to engage all segments of society into this search for development. Then, of course, there has to be creativity and innovation and inclusiveness in development process. And as I said, equity. If we can have a system that has all these elements, that system is likely to resist pandemics like this or any other crisis. Or if they hit, they are likely to bounce off it and move forward. Now, that's not easy because resilience is not just a structural, institutional thing. It is mainly in the mind. And the question that we asked ourselves is what kind of mindset is associated with resilience? First, there is love for life, determination to survive, love for well-being of humankind. We can summarize it into humanness. And then a mindset of creativity and innovation, and a very strong concern for future generations, what we could call foresight. Persistence in search for solutions to problems and challenges, and a belief in effectiveness of collective action rather than individualism. These are some of the mindsets that can be associated with resilience, and they need to be developed, especially among public sector workers, like public servants. But there is a bigger problem. There is a bigger problem, and this problem has to do with the extent to which the objectives of Sustainable Development Goal 16 are achieved, which especially in the area of effective and strong accountable institutions. This we can see by examining the relationship between the state and the citizens. And I decided to call that as the playground of public servants. I always say that you do not expect good swimmers to swim in dirty pools. They don't like it. Probably they will not even go there. And so this relationship, this governance relationship between state and citizens is the ground in which public servants play. When it is dirty, not play in it, or when they go there, they will not play well. That's why I said the countries that have cleaned this playground, where the relationship between the state and citizens are good, they have fared better in this pandemic. Now, one of the most important aspects of these relationships, I'm not going to touch on each of them because then it means I will not say anything else, it's a lot, is what I call the humanness. Humanness and moral guide by example from all levels of leadership. As you know, we have been complaining about bureaucracy, and this is mainly what makes people see governments work as if they are not made of human beings, or as if they are not serving people. In other words, from public sector leaders, we needed to see humanness and moral guide by example. Humanness, as I said, it's the concern, the love for human beings. That's when the services can be provided better. That's when a pandemic hits, this humanness mobilizes all aspects of government, all aspects of public service to cover every citizen to make sure that they are protected. Now, when that humanness is lacking, then you are not going to have government as a provider or government as a defender or government as a listener or government as a collaborator or an educator, informer, or even a pacifier. Most probably the government will lose legitimacy and credibility, and it certainly cannot protect its citizens. So it's very important that public sector workers, government leaders are seen to project the love for the human beings that they lead. This is when the playground for public servants will be good and it will be conducive for them to work, to sacrifice even their own lives for the sake of serving the people. And if you want, you can again do a survey of the whole world and see how countries reacted very quickly to make sure that their citizens don't die because of this. Now, those who didn't reflect what I'm saying are still having it rough when other countries are saying we are out of the waters now. But for them, they are sinking further. I don't want to give you examples. As you have heard, I work at the United Nations, and sometimes we have to curtail the country examples that we use in such matters. So, since now I am talking to public servants, I think there is room to examine, or rather to discuss, the role that public servants play in all this, meaning the implementation of the 2030 Agenda or the 2040 Vision or the 2050 East African Vision or the 2063 Africa Agenda. What role do they play? Now, there are two things. One is in sort of a normative way, in a normal way, what role do they play? What role were they playing before they were interrupted by the COVID-19? That diagram represents the different roles the public servants play. If you pick any development strategy or even a government constitution, you will find the role of the public service stipulated. In the case of Uganda, the development policy and strategy planning is not highlighted very much. It is rather the implementation. I would want to say that needs to be discussed, because if you look at public service right from the lowest grade to the highest, I don't see how government would develop policy or strategy without inputs from public servants who have the most relevant information and the most relevant knowledge and skills that go into formulating this policy. Policy making is a complicated thing. Policy is not only made by ministers, policy is not only made by parliamentarians. Policy is first and foremost made depending on the inputs from these public servants. It is very important. Then delivering services, developing infrastructure, mobilizing communities, mobilizing resources and utilizing them very well, and then monitoring, evaluating these policies and strategies, and all sorts of capacity development. These were the normal roles that we would expect public servants to play, and in many respects, they have been playing these roles very well. But all of a sudden, this COVID-19 hit, and we could also examine what roles public servants have played in dealing with this COVID-19 pandemic. I think Madam PS had already talked about ensuring continuity of service. This is the most critical role public servants play. And it's not even a role, it's a cardinal, it's like the central chapter of the Bible of public service, doing services under all circumstances. Self-sacrifice, courage, and humanness in practice. You don't put your life in danger unless you really love the people you are trying to save. I don't know whether you have ever wondered what it is that makes a man run into a burning building to save people who are burning when he could also burn in there. When it's a comfortable thing to do would be to run away before he burns. But because of the love for human beings, many people do very courageous things. This we have seen during the pandemic. Pandemic has also demonstrated that public servants can do quick thinking and become creative and innovative. That's why I'm talking to you like this. Otherwise, I would have had to come to Kampala and take that journey. There has been resource allocation and distributive accountability, collaboration, networking, and leadership, and awareness creation. I don't know where people would be if public servants, whether it is in the media or in research centers or in hospitals, had not covered this virus and the way it spreads and the way it can be contained. By now, probably be finished. Strategic planning amidst chaos. Now, normally that is supposed to be a difficult thing to do, but many public servants have done them. I know that in Uganda you have got task forces at different levels, which these task forces have been doing strategic thinking, and it is difficult to think strategically in the middle of chaos. It's like you don't sit in a burning house to think strategically, but public servants have done it, and they need to be congratulated very well. And in many countries, because public servants thought very quickly, sought solutions, and then continued delivering services despite all this chaos, and trust and credibility of government was enhanced. There are some governments who mishandled the whole thing and then lost all credibility. So it's very, very important. Now, in that case, then we can ask ourselves, it isn't going to be the last pandemic. And so what is the profile of a public servant that can work in such crisis? This is a good question for people who are responsible for training public servants, like Madame Savia Mgwanya, who supervises the Uganda Civil Service College. What could we call the DNA of a public servant that can work effectively in such situations? If we could answer this question, then we would embark on the job of making sure that every public servant has got this DNA. in themselves. As I said, there are many, but they are central ones. The very central one is humanness and empathy. That love for human beings, the human beings that you serve. You see, and maybe this I should say to those public servants who are still young. There is a tendency to say, I want to be this and this. I want to join the public service and be a permanent secretary or a head of public service. I want to be a minister. Probably it's good to have such ambitions, but so what if you become a permanent secretary? I think the right approach would be, I want to do this. I want to make sure that I teach people. I want to make sure that I cure people who are sick. Then that way you become a doctor and want to do. On the other hand, if you say, I want to be a doctor, when actually you don't want to cure people, then you will become a doctor and kill people. It has happened. If you say, I want to be a policeman, and you work hard and you become a policeman, when actually you didn't want to save people, then you start killing people. You have seen police people killing people. So the approach with this DNA of humanness should be, I want to do this. And then you work hard and get positions, and then you do it. The other one is humility. The rest you can read. Technological know-how, it is right now, it is in practice. How would we have met if we didn't have this knowledge? Persistence, adaptability, that ability to shift when circumstances shift, trust and credibility, future orientation. There are very many you can look at and say, if a public servant has got to effectively work in such situations, they have got to have this kind of profile. And this is irrespective of which country you are talking about. I have talked about future orientation. I want to focus a little bit on it because it has to do with foresight and anticipatory public service. You see, many countries were caught unawares by this pandemic, and that is not supposed to be the case. Because there have been pandemics before, which means countries should have put in place infrastructural arrangements to react very quickly to see the problem and react to it and find the solutions. In many countries, this did not happen up to now. They are in search of solutions. In countries like Korea, they were prepared and they didn't have a big problem despite the seriousness of the attack. By the way, in Uganda, you may not realize this, but from afar, from what I read and observe, the way you reacted to the COVID-19 pandemic was in a way informed by the way you reacted to other problems like Ebola. So you had, in a way, if not prepared systems, at least prepared government mindsets to say, we better react quickly, otherwise we are finished. So that's a future orientation. But there are many things that come into this. You need people, I called them scientific prophets. You need people who can very easily have the data, analyze it, observe trends and spot problems, and then find solutions before those problems become catastrophes. That's what a prepared public service would be. But such people cannot work, cannot thrive in institutional or legal frameworks that don't encourage foresightedness, that don't encourage creativity, that don't encourage innovation, that don't encourage collaborative problem identification and problem solving. So individuals alone with a An anticipatory mindset will not help if, as I said before, the playground is not clean. There has to be that. Now, there is what I have put in red because I wanted to focus on it. There is nothing dangerous about it. I just wanted to focus on this, on the youth and the public service. I think that it is very necessary that the public service attracts the youth, especially the best. What many universities these days, the public service should be able to attract the best out of those universities so that they can get into public service. But I think there is something that I have been observing in Africa, not only in Uganda, where there's a growing conflict between the young generation and the old generation in the public service. And I think there is a need to find a way of handling this because it is not necessary. I conceive the whole work of development as a race, as a relay. You know, there are those who are running and they will hand over the baton and the other ones run. Now, if you have ever been, if you have ever witnessed a relay where there is a conflict among the different team members, normally they lose the race because the one who is supposed to get the baton is supposed to prepare to receive it very well and run. But the one who is bringing the baton must also not only run very fast, but also prepare to hand it over very well, otherwise it will drop and then the whole team is finished. So this conflict between the youth and the old is absolutely unnecessary. It is even destructive to the development process. I'm still wondering through what mechanism both sides can realize that they are running the same race and they should not mess up because of this conflict. I have two slides to conclude with. The first one is that is the will to implement all these programs, the 2030 agenda, the 2063 agenda, and the 2050 and the 2040. Normally when you hear people either complaining or praising, they focus on the political leadership as the ones that are supposed to implement. I think this is unfortunate. What you need is what I would call total will of the entire society to implement these programs because they are made for the society, not for politicians. Especially since the 2030 agenda says that the whole thing is focused on the people. And every constitution of every country, when you read, including the United Nations Charter, it starts with the people. So I think we should not transform with the people into with the politicians. Yes, there is a need for political will to implement these programs, but there must be also administrative will. You public servants, you know, we wield a lot of power in terms of our knowledge and skills. If we don't want, or if we decide to delay, these programs will not be implemented. So the administrative will is needed. The social or civic or community will is very necessary. If the people don't want, they just mess up the whole thing. And again, if you are a country that needs assistance, then development partners must be willing to assist you to implement. So this emphasis that is put on political will, again, is misplaced. It's not the right one. The whole society needs to be mobilized in order for these things to succeed. And we have seen it during this pandemic. Yes, some political leaders have messed up, but even in situations where political leaders have messed up, societies have figured out how to make themselves survive despite the messing up by political leaders. So what I'm saying, this kind of job shouldn't be left to political leaders alone. And when we do that, what we are doing is that we are encouraging political leaders to be dictators, because we are telling them, if it is not you, then we are finished. So if you say that to me, I imagine I'm very important. I don't accept anybody to criticize me. And then finally, Excellencies, ladies and gentlemen, all these can only happen when the competences and mindsets of people, of leaders, of public servants are synchronized. I think someone in the Ministry of Public Service has got these PowerPoints. So anyone who wants them, they can be emailed to them so that you can look at them in more detail. Because as you have noted, if I pick each point, we cannot finish. But the point I'm making is that it is not enough to have institutions. It is not enough to have systems. It's not enough to have knowledge and skills or even competences. It is very important that the mindset is correct. Now, since I'm talking to public servants, I'm going to talk about their administrative competence, which leads to compliance with laws and regulations and consequently enhances professionalism, ethics, integrity, and rule of law. If you have people who have that administrative competence, then you should not have problems with rule of law or with professionalism. You should not have issues of lack of accountability and then corruption and all this. So that's the administrative competence. But you can have someone who studied public administration or administrative law and so very knowledgeable, very skilled, very competent in that. But when you look at the mentality, if it is not synchronized with that competence, then that person is actually going to be dangerous because he knows a lot, and so he can use that knowledge to do harm. So in order for that competence to be actualized, to become useful, what you need is a mentality of the belief in law and order and controlled power and authority. So if you have someone who believes that when I am a director, no one can touch me, that means that person does not have a mentality of controlled power and authority, and therefore that person will do whatever they want. Look at this country where I am, I think you can see what is happening there. So it's not enough to have the administrative competence. It is also important that individuals who have that competence have got this belief in law and order and controlled power and authority. And above all, they love human beings. And so they cannot use their knowledge of law to dominate, even subjugate the human beings that they serve. I will conclude there. Honorable Minister, Madam PS, and all the public servants who have been listening, thank you very much for having given me the opportunity to give you address. I thank you.
Thank you very much, Dr. Kauzia. We are once again quite privileged to listen to your very well researched paper, which is has such in-depth knowledge of public service and public administration. You have definitely done the paper justice, and we cannot thank you enough. Also for sacrificing to be with us. We know this is home and part of work, but we don't take you for granted. We are sincerely very, very grateful. And I'd like to lead the team if they can unmute so that we can give you a round, a round of applause. Everyone, in 1 minute, unmute, and we give a round of applause.
Asante sana.
Thank you very much.
You're welcome, Dr.
By the way, my second half is that way. The pandemic has done what the church said it should never do.
Oh dear.
What God has put together, no one should put asunder, and then this pandemic did it.
And then the pandemic puts us under. That's unfortunate. But
Yeah.
fortunately, she's with us as well. Thank you very, very much. Over to you, Savia. Doctor, have a good morning sleep.
Thank you very much.
You're welcome.
Pleasure talking to you all.
You're welcome. Over to you, Savia.
Thank you very much, PS. Thank you very much, Dr. Kauzia. I think you have given us a good picture of the composition and kind of civil servant we need to be looking at in terms of competences and the mindset. So with that, I think we'll call upon our participants to give we have comments, questions. I think we have time for 5 of them. But we also want to recognize, I think we've been joined by one of the head of human resource from Masindi has joined us. We want to welcome you on board. So, ladies and gentlemen, I believe by now all of you have your provision of your microphones. Initially, I think we didn't have that, but you now have your microphones activated. But what we are going to do is we are going to have you put your hands up. I hope all of you are able to get to that function. When you look at the lower part of your screen, you have icons, and there's an icon for participants. When you get to the icon for participants, it will give you a provision for raising your hand when you need to say something. And when you have finished, you can lower the hand. So we will go into and Dr. Kauzia is still with us to take on those questions. So ladies and gentlemen, you're welcome to ask. That we have 2 hands already. And the very first one is from our special guest who has been subjected to the negativity of being put asunder because of COVID, but we thank you that you have taken the trouble to join and be with us and also support, psychologically you're supporting Dr. Kauzia. So Risa, please, let's have you give a comment. I have seen your hand is up, after which you'll be followed by Mr. Jock, and then we will have William Bino. But let's start with Risa. Risa, you're welcome.
Yeah, thank you very much. I just want to thank you for arranging this kind of meeting and for including me also. I want to thank the PS. I just have one problem with the public service. We still have people who have not had that kind of mindset, where they have got to do what they have to do without expecting so much. I have seen the theme today, above self, so much like Rotarian kind of thing, where I belong. How are we going to ensure that people are putting service above self?
Thank you, Risa. Is that all?
Yes, please.
Okay, thank you so much. And I think that is quite critical. Mindset change is never simple. But thank you for allowing us to make Dr. Kauzia get some sleep dates. I am sure he will recover. Thank you. Let's have Thomas next. Mr. Jock.
Yes, good morning, Madam Savia.
Good morning, Mr. Jock. You're welcome to the discussion, and you can start with your question or comment to Dr. Kauzia. Thank you.
Thank you so much. I would like to appreciate Dr. John Mary Kausa for the presentation, which was very touching. Specifically, I was touched by the DNA of a public servant. Thank you, my brother, and thank you for being there for us. However, there is a slide of what I've seen, which has touched me there and up your mind on, is that you're encouraging us to encourage the youth to join public service. I think that's a great point. However, there's challenges of attracting the youth, specifically in public service of Uganda today. Dr. John, I hope you're aware of the challenge of skills mismatch, especially among the graduates who are coming out of the public or the universities or learning institution in Uganda. Sometimes, though the number is many, but we have found challenges with some of the skills that they have, which may not necessarily be relevant with the one which is required by the Uganda Public Service. I would like to tap your mind on this. I don't know what your take on this. Maybe you can share with us your opinion on this, the challenge of attracting the youth in the public service, specifically regarding the skill mismatch. Thank you so much.
Thank you, Thomas. Actually, that is a very fundamental issue. And if National Planning Authority was also here, I think that would have really been fundamental in terms of the issues they address. But we will hear from Dr. Kauzia. Can we next have Mr. William Bino, please?
Thank you so much, PS, and thank you for the opportunity. Thank you, Doctor. I hope I'm being heard.
Yes, I can hear you.
Yes.
But the interruption of the sounds. Anyway, I am looking at the presenter, the keynote saying, encourage youth to join public service. It sounds like we young people, we don't want to join. But in actual sense, there is will, there is courage. But somehow, somewhere, the ground is not leveled. How do we ensure a leveled ground so that we can join the public service? And how do we ensure that the old are willing to let the to the young people? Secondly, I'm looking at the element of the skills. We did a research, a labor market research, a youth labor market research with the Makerere University and the IREX in 2018. What was lacking among the youth was the soft skills, how I communicate, but they have the technical skills. So we have technical skills, but we are lacking soft skills. How are we ensuring again that our universities not only focus on imparting me how to be a better development officer, but rather ensure that I can fit in the society, in the district, in Namaingo deep there, and match perfect in that system. I have the last one. I would like to be, I am somehow disturbed. I am looking at the global agenda, which is Agenda 2030. And it lays out everything, which I assume once we achieve everything, we can be at a level or a better world. But now, I'm looking, my African continent lacks actually more 33 years for us to be at a certain pace. So what is there in Africa that we cannot move with? For example, Agenda 2030. Oh, for instance, maybe let me come to Uganda, we have extra 10 years. So what are those things so that we can maybe focus on it and try to pull time back and we achieve development and social transformation in the nearest time possible? Thank you so much.
Thank you very much, William. We now next have Mr. Ogeni Morris. Please come in with your comment or question. Thank you.
Thank you very much, panelists, for this program. I have a concern, especially on service delivery. In the country, the country is really forming new administrative units, and yet they take time without being financed. For example, if you look at Masindi, We have Kiatiri Town Council and the Bulima Town Council. These have taken like 2 financial years without being financed. And this also retards the service delivery. We also have municipalities and the district. You find we have councillors in the municipality, in the council, I mean, councillors from municipality representing the municipality, the district council. They're being paid, and also have councillors coming from that area. So we find they're duplicating of resources. And then another problem also, like you find most civil servants, they're at work, and some of them really do a lot of, okay, they error, but we have a very weak way of punishing them. The only thing always do is that to transfer them to hard to reach areas, but they don't reform. So I think something should be done in that line. Thank you very much.
Thank you very much for highlighting the constraints that the new administrative units are facing. I think we can allow Dr. Kauzia now to come in. There's a question that has come through on the question and answer chat. I'm going to pick that up in the next phase of questions, which will probably be 3 or 4. But for now, let's allow Dr. Kauzia to make his comments. Dr. Kauzia, please come in.
Thank you very much for listening and picking out these issues. They are very pertinent issues to raise. I'm going to see whether I can follow the order in which they came. How do I address her? The first question. Madam Kayuzia, how do we have the mindset? I think this question is a societal question, first and foremost. You see, we tend to think that people are not well trained in universities, and so they have a wrong mindset, but you never know. I think a mindset is cultivated right from the family, through kindergarten, through primary, through secondary, through university, and through other forms of training. And then it develops further with experience, with the people you interact with and the way they treat you. It's not a simple thing. And I think the answer to this, I would say, there needs to be a discussion around the role of families, the role of these social organizations, including religious organizations like churches. Developing a good society is not just a matter of taking people to school. Society has also got a role to play, right? And then when people join organizations, supervisors who are in those organizations can have an impact on the way these people behave, depending on the way they treat them. I think that's what I can say for the time being. And even at the level of recruitment, if you recruit a thief and then he steals, then you complain. Is there a way of, for example, handling recruitment processes such that you don't recruit accountants who know very well accounting and finance management, but in mindset they are thieves, and then you make them cashiers? How do you make a thief your cashier? And then you expect your cash to remain safe. I think there are ways of doing this. The second question came from Mr. Ojok. Is that it? Challenges of attracting the youth. Okay, I know that it is challenging to attract the youth, and it is multifaceted that challenge. I'm sure, especially in the context of unemployment of the youth, there are many who would be happy to join the public service. But remember, I was saying that the public service should try and attract the best. So not just attracting young ones, but the best, so that you have people who have got high capabilities, and by the time they get to these high level positions of directors, commissioners, permanent secretaries, they are highly analytical, and when they propose a policy, it is a policy that is grounded because they are smart in looking at problems and analyzing them and finding solutions. I was talking about attracting the best. Now, I'm going to say something which might shock you about the complaint that university students, when they cross into public service, they have no skills that fit the jobs. You're absolutely right. And the reason is this. Basically, universities are not the best places for grooming workers. Universities are good at passing knowledge on to young people. And when these young people cross into jobs, then there has to be an intensive program to turn them from just being knowledgeable people to being competent and public servants or private sector workers. So there is, I hope you listened to Madame Savia when she was introducing me. I felt a little bit embarrassed because I normally don't like being introduced to that extent. If you see the schooling I underwent after my first degree, then you can understand why the PS asked me to talk to you. That's not the knowledge I came with from the university. The knowledge that I have, the skills that I have, the mentality, it was built after. And so, and the good thing is that we are discussing this within the Ministry of Public Service. It would be good to have university graduates who can immediately work. But that's not the correct dream. It is not going to happen. Normally, you are going to get people who have the knowledge and who have proved that they have capability to accomplish something. Once you recruit them, then you embark on grooming them to do the job you have recruited them to do. Of course, this depends on jobs. You cannot say the same thing with doctors. When a doctor has gone through the whole training, has done internship, they cross and doctors, although there are some still who don't have the right mindset. But in terms of knowledge and skills, they can do the job. That you may not say the same thing with engineers, for example. Engineers might be conceptual, and then you give them a job which is practical, they can do it because probably they were not trained to do that. I know Macquarie University, when they are training public administration, they emphasize political science. Now you cross to become a public servant, literally you don't know. So you have to be trained. In other words, I'm challenging the public service to realize that after you have recruited someone, you have to develop that person. The person you want that person to be. I think there was a question about the not wanting to, not willing to give way to the young. No, I think they are willing. First of all, I think there is a retirement age. Even if people, I know there is a practice where people get retirement and then they get contracts and they stay for some years, but still they will leave. So I'm not completely sure that they all don't want to give way. Actually, the complaint I was making about the conflict between the young generation and the old generation in the public service is this assumption that if those who reach retirement left, the problem of unemployment would be solved. No, the problem of unemployment in Uganda is so huge that even if you sacked every public servant and replace them with new, you would still have the unemployment problem. So solving the unemployment problem does not reside in making sure that the old people leave the public service. I think that is being used for political reasons. Statistically, it does not solve the problem. But I know that there is a system which makes people enter the public service, get retirement, get out, and then the young ones, there is that capillary pull up. So my problem is at the entry point, not at the exit. I think at the entry there is a problem. The best are not attracted. There was a time when the best brains from universities entered the public service. And now it's no longer the case. And I think that probably is one of the questions that someone was asking about lack of transparency in the recruitment process. I think your observation about lack of soft skills is a big one. And again, you cannot pin this on universities. It's the entire system, right from family through the entire schooling system, and someone gets out of university not knowing how to live in society. I think these are some of the soft skills you are talking about. And then the question about the 2030 agenda. First, let me correct an impression. The 2030 agenda and the 2063 agenda are one. If you read the 2030 agenda for sustainable development documents, you can Google and read it. That resolution, which is the United Nations General Assembly passed on 15th September, I think it was 25th September 2015. Paragraph 42, of course, it is my job to support the implementation of that agenda, so I know it like a Morocco knows the Bible. Paragraph 42 makes the Africa Agenda 2063 part of the 2030 agenda. So they are not separate. But as an African, of course, I sometimes point out that 2063 agenda so that people don't say, why you as an African, you are talking about the 2030 agenda and you are leaving out the 2063 agenda. But paragraph 42 makes the 2063 agenda part of the 2030 agenda. Now at national level, this is why I took the trouble to look at the principles enshrined in the 2030 agenda and compare them with the principles enshrined in the Constitution of Uganda and the Vision 2040 of Uganda. And you can see that they almost match. That's what they call localization of the 2030 agenda, such that the principles it puts in place are integrated in the national development strategies. And most of the things it seeks to achieve in terms of the 17 goals, literally every country has them in their plans. Now, the 30 years, the 2030, the 15 years deadline was an estimate. And you know, development just doesn't happen like thunder. So trust me, by 2030, you will find many countries will not have achieved all the 17 goals and the targets, but at least they will have started and achieved something, and then they will continue. Because sometimes you in the development processes, you have to accept that what you start and hope that it will end next year does not end next year. The important thing is that you insist and continue. What was the last question? But there was a question of what can we pull?
Administrative unit.
the most important is the utilization of the human capital. And again, let me say something that might shock you. If you take an example in Uganda, the human capital from the young to the old who have reached an age where they can't do anything, on both ends, there is wastage. If you can count how many university graduates are not employed, how many high school graduates are not employed, all that is wasted capital. If it was put to use, that would be development. Now go to the other extreme end. The retirement age, is it still 60? Now, if the retirement age is at 60, right now I'm 63. And I feel like I'm just starting. So you get me out of service, and then you start paying me, what do they call it? Retirement benefits, this kind of thing. So you are paying me for nothing when actually I'm fit to work and I'm still capable of working. That's another wastage. So you have wastage at the beginning and wastage at the end. That's a lot of human capital wasted. And development is a direct consequence of the utilization of the human capital. So, Ministry of Public Service, Ministry of Labor, and Ministry of Planning, these are some of the issues where you sit and say, how do we stop this wastage of human capital? Because when you are making pots, if you throw away the clay, it means you have thrown away the pot. So you can't throw away the clay and then you expect to have the pot. We are wasting human capital, so we are wasting development. This is conceptually, this is the way I see it, and it's not good for a country's development. I think Maurice asked a question about service delivery, new administrative units. I don't think I am competent to answer this for two reasons. One, I am actually an adamant defender of decentralization. And when you read the objectives, the original objectives of decentralization was to take service to the people. And it was a noble objective. But as they say, sometimes the way you plan it, along the way of implementation, it doesn't work out that way. But I think still the objective is still correct. And why I'm saying I'm not competent to answer that question, I don't know why. It happens like this. If you establish a district, by the time you declare it, everything should be aligned to make it work. Now, what happens when you don't do that? The people who had hope in the new district, they lose hope because they have waited for a year and the district has been in existence and they don't see what it is doing. So they lose hope, not only in the district, but in the entire program of decentralization. And you don't want to have a population that mistrusts a program like that. Thank you very much. I think those are the questions that were asked.
Thank you very much, Doctor. We will only have two more, and the first one was actually written. It was from Masimile Rita, and she highlighted the issue that was being raised about encouraging the youth to join the public service. And she said, the question is, how do you encourage the youth to join a service where you have a lot of lack of transparency and a lot of political dynamics at play? How do the youth get into that kind of environment? So that would be the first question. And then we can have one last question. If at all there is no hand, we will not have one more. I don't see any hand. So we take it that that is what it will be. So Doctor, if you can come in with that. I note you raise a very important matter hereafter. I think the debate on wastage of human capital should be what we pick up hereafter. That's going to be a very critical debate for the service. But Doctor, please come in on that one.
Yes, thank you. Thank you. Is it Vita who asked? Thank you. I think this refers back to what I said about cleaning the environment. You see, sometimes I struggle to remain diplomatic and especially today. Mind you, today we are celebrating public servants, and now you cannot start complaining during a wedding reception. You just enjoy. But still, the problems are there. Came to celebrate, and I was not in the mood to over criticize, because I knew we want to encourage public servants. But still, this refers to what I said about cleaning the playground. just switch playground with environment. That's one, and that's the job of government and society and all these political players. But most importantly, I think in the preparation of the youth, this goes back to the comment about soft skills. In the preparation of the youth, all these training institutions should always make the youth understand that out there, it is not all rosy. You cannot, the environment is Uganda's society, and anyone who wants to join, let's say, the public service should have a mindset of saying, I'm joining the public servants. This is my ambition. I want to do this and this. And then have a mindset that confronts all these challenges. Because while we can say, how do you attract these young people into a public service where things are not good, still there are young people who join the public service and grow in there. So if I was talking to, let's say, university graduates who haven't found a job, I would tell them that don't expect to go there and find everything on a silver plate. You are joining a battle. And unfortunately, the ones that were first on the front line, which you are joining, they are better prepared in terms of the difficulties they have been facing. And so you go there and observe. You may observe and find your boss is corrupt, but you don't have to be corrupt like your boss. You can say, okay, now I have understood this. Let me give you an example why actually I'm here in New York. When I was at the university, it was clear that if you joined the public service, the guarantee you will get a house, you most likely you will be driving a nice car. But then when I joined the public service and started doing consultancies, I started realizing that the many people whom we saw on the road enjoying life, they were not enjoying life because of the salaries they were earning. The moment I got that, then I said, oh, okay, I really don't want to be corrupt. What I'm going to do, I'm going to study up to the highest level and find a way of getting a job where I can live on my salary. This is because when I was doing consultancies in different organizations and ministries, I got to realize that people who had big houses, big cars, they didn't have them from their salaries. It was not possible. It's still the same situation. But I was young when I joined and I learned. So the young ones, if only someone can explain to them before they join, that don't think you're going to join a rosy situation, that this and this and this and this obtains, but you join and contribute to the struggle of making it better. That's the way I would reflect on this, because most of them come expecting a lot, and then they get there, they find the lot is not even there. Thank you.
Thank you, Doctor. Madam PS, back to you.
Thank you very much, Doctor. You have again done it justice, giving us a kaleidoscope of ideas and perspectives. About the issue of local government, we'll pass it on to local government, but later on maybe we'll talk about it. I have loved the way you have brought reality into this discussion about the giving the moment of truth at the beginning. You don't let the youth enter into the service and then the egg breaks, so to speak. You tell them right from the beginning. And I think that is a very, very critical point, that they come in with dreams, big dreams, some of which have been actually colored by officers who don't have a very high level of integrity. So you find that they are seeing the big houses and they think, okay, I'm going to get it. But if that myth is broken right at the beginning, then you'll have civil servants who are more focused. And then they'll also be looking at other avenues of enhancing their income. I recall 20-something years ago when we entered into the civil service and we had our induction. There was one officer who long left the civil service, but he broke that. He told us, you will face disappointment. And he gave us options. If you can't get promoted on time or you feel that you're not earning enough, there you should be having a plan B. And he gave us options at every level what the plan B was. Some of us took that, others did not. But for those who took that and kept an open mind and looking at the other options they had, they remained focused on the job. And that is very, very critical, that we need to unmask this myth and demystify the whole bit about rich and affluent public servants, because that's not what the public service is about. But there are ways in which we can inform our officers right from an early age on how they can grow their wealth and at the same time work diligently. For example, the youth who have engaged in tree planting quite early, those who have come into the service and have still gone into, for example, coffee farming or tea planting before they have burdens of huge families and all sorts of expenses. So you find that these are more resilient workers because they have a farm base. But it takes someone to give that tutoring right from home, and if it hasn't come from home, in their youth, you tell them early enough and give them as many ideas as possible on planning how they will survive in the world and how they'll eventually retire. Doctor, I thank you very much for that emphasis. And also on the human capital, we'll discuss that. Thank you very much and wishing you a blessed day.
Thank you. Thank you. Have a nice webinar. I think if I stay, I might knock my head against the computer. So
Sure.
Thank you very much for inviting me. It was a pleasure talking to you.
You're welcome. Over to you, Savia. Doctor, thank you.
Thank you very much, Dr. Kauzia. You definitely must catch up on your debts. We don't want you to be a zombie hereafter. So thank you so much.
Okay.
Ladies and gentlemen, I know we may want to have a few minutes of virtual coffee. Just hold on tightly. We will be there shortly. We will have a break, but you will allow us to proceed into the next session because we already have our chief executive from the Public Sector Foundation Uganda with us here. That is Mr. Gideon Badagawa. He has been on board. We took a bit of time to start, so we may not be doing well on time, but allow him to come on board. And then we can have a virtual coffee break thereafter. But before Mr. Badagawa comes on board, allow me to introduce him to you. I know he's not new to many of you. So please allow me to introduce him in an official capacity to you. He is the executive director of the Private Sector Foundation Uganda, a position that he has held since 2010. But before that, Mr. Badagawa was an executive director at the Uganda Manufacturers Association, and he was there since 2008. You may wish to note that actually before going to the Uganda Manufacturers Association, he actually had worked at the Private Sector Foundation before, and that is where he grew up to the level of a director. And prior to that, he had also done some teaching. By the way, he is a statistician by training, and he had been teaching at the Institute of Statistics and Applied Economics in the Department of Planning and Policy and Planning, Applied Statistics, sorry. Department of Planning and Applied Statistics. So that's where he was before he got back as the Executive Director in Uganda. But he also sits on the board of the Economic Policy Research Center. He's a member there. And by virtue of his training, he has a master's in development studies, econometrics and economics, and also a master's in development economics, which were all attained from the Netherlands, one from the Institute of Social Studies and another one from the School of Maastricht, where he got also a postgraduate diploma in environment management. So on that side, he is an all-rounder, and he is coming in to tell us what the private sector that he leads is expecting from the public service at this point in time. So Mr. Badagawa, we want to welcome you very much, and you now have the floor to take us through your expectations as private sector from the public service. You're most welcome, Mr. Badagawa. Ladies and gentlemen, please welcome Mr. Badagawa.
Thank you very much, moderator, for this opportunity, very important opportunity, I must say, to have joined you this morning from the private sector fraternity. Honorable ministers, the head of the civil service, ministers of state, the public servants that are listening to us on this virtual platform, our guests, and especially the guest speaker who has just presented a very, very eloquent paper. And all of us who are listening in, I really want to thank the Ministry of Public Service for this occasion, but even more importantly, to congratulate all our public servants for a job well done on this occasion when we mark the 9th Africa Public Service Day. Congratulations to all of us. As you have heard, public service is not new to me. I think the first 10 years were spent in the public service. And the last 20 years, if you like, I've been with the private sector. But private sector is also public service at any rate. So I would consider myself to really have served the public for the last 30 years, if you like. So I am joining you as part of the public servants that are commemorating this day. And I will try as much as possible to put across the best that I have out of the list that I have. And like our keynote speaker has said, we are really here. I like the analogy of the wedding ceremony. We are here really to celebrate. So we may not really talk much about what needs to be done to improve, but really to appreciate the efforts that the public service has offered to humanity. I think we can begin with some statistics. And this was alluded to earlier because our keynote speaker, I think at some point said that, look, even if all the public service was required to go away, you wouldn't solve the problem of unemployment in this country. And indeed, this is true, because we all know that the public service is actually less than 1 million people that are supporting and offering the services that we need, the services that the 43 million Ugandans need, both local and foreign that are here. And I'm talking about the students who are going to school, the patients, people who are looking for investment licenses, who are looking for land. So you want the land registry, and you want a service, people who are looking to feed their children, to immunize, you need the health workers and so on and so forth. So really it's been a protracted struggle by the civil service, and I really want to appreciate you for this. Now, we know that all public servants the world over are really part and parcel of the private sector and the civil society, where we live and where we come from. Because when you are recruited in the civil service, you cannot go away, you cannot be divorced from where you came from. And that is the private sector. Actually, indeed, what's going to happen when you retire is that you join the civil society or the business by and large. So the challenge, therefore, for the ordinary, like the average public servant, is therefore to provide fully yourself to the private sector and ensure we have a soft landing when we retire out of the public service. So if anyone is wondering why they went to school, it's largely to serve humanity, to be of value to society. This is why we go to school. And I think the keynote speaker has alluded to this concept of value and principles. So we can get the job, but the most important out of this job, because this is a service, you are talking about public service. You are talking about the people you serve, the environment you live in. And we in the business community know very well that most of the times that we serve the public, it's this public that will either allow you to continue in business or to shut down that business. So civil service, public service is about humanity, is about the value you offer to the people you serve, to society. And this happens with the civil service, or should happen with the civil service, just like it does happen with the business and politics. And I really want to pay tribute to our public servants that retire after 30 years, after 35 years of public service. The other day, only the other day, I think we saw the Chief Justice retiring after an extended period of service. And this is service to humanity. For someone to have gone through 30 years and 35 years serving humanity without a blemish, I think we really need to applaud such people. So the people you serve, or in business, we talk about customer care. The people you serve is therefore extremely crucial each time you are invited to serve in the public office, whether as a politician or as a civil servant. And I really want to unreservedly pay our tribute as private sector to our frontline staff in the health sector that have and continue to work out there to save our lives. Some of them have had challenges on accessing and utilizing personal protective equipment. We think that we cannot take this for granted. Now, focusing attention on the people that need your service is what makes you relevant. And it is in the self-interest of any public servant to know your customer. I think knowing your customer is one of the very, very, very popular concepts in business. In business, this is the underlying principle because the customer is considered king and has the power to shut down our businesses anytime they choose to. So continuous improvement should remain variable, although the illusion by many public servants has actually been that they are permanent and pensionable. This compromises service delivery. Yes, you can be permanent, but as we have said, we have had, at some point you will retire. So you get into the public service, you serve 30 years, 35 years, you can have the contract thereafter and so on. But like the keynote speaker said, the ultimate is that you will get out of the public service. You'll give way. So we cannot continue to sing, we are permanent and pensionable, because as I said, this will compromise the way we deliver services. Because it locks down innovation, it locks down creativity. These are critical facets if we are going to remain of value during the time that we serve as public servants. The new world order now is that you will only remain in your position if you are consistent of value to the environment and the people we expect you to serve. And this is why performance appraisals must always be undertaken for all of us. And I want to suggest for the public service as well, because this is the litmus stage. Are you of value or are you not of value? The keynote speaker alluded to the principle of professional development. When you get into the civil service, you must have a self-drive. You yourself, you actually expected to grow your career, call it the career development. You need to be open to new dimensions, new ideas, new training, human development, so that you grow in value. And then you need to change the mindset as you grow. Because once you have a fixed mindset, then this cannot help you grow out of range. So understanding your client needs is very, very important. And this is the reason the private sector has implored the Ministry of Public Service to periodically conduct customer service surveys, to conduct customer satisfaction surveys across all the ministries, departments, and agencies of government, so that we know we are keeping our fingers on the pulse. Are we getting it? Are we not getting it? This is the whole value in undertaking performance appraisals. And we do it every so often in the private sector. So we must every day mirror our performance to the needs of the citizens of this country in health, in education, in security, transportation, in energy, provision of power, water provision, and so on. This is by the public service. So the efficiency and effectiveness with which you offer these services to the public matters a lot. And it does not only take qualifications, it takes values and principles. And I really want to applaud our keynote speaker for bringing these facets out. PSF and government have collaborated to conduct annual performance reviews for ministries, departments, and agencies of government, like the Revenue Authority, the Registry Services Bureau, UNRWA, Capital Markets, KCCA. These are all interfacing with the private sector. So we are bothered if they are not up to the mark every time we approach them for a service. And this is now jointly convened with the private sector every year, and we applaud government for this very important partnership that we now have. And I hope it continues. And secondly, we need to establish a public service contributory pension scheme, for which the bill is yet to come out of Parliament. I think this is going to be very important, especially to provide safety, economic safety, when our civil service, when our public servants come out of work and they are settling back into the private sector, into the business, and they are able then to be able to fend for themselves and their families. The idea here, as I said, is to provide a more stable future for our long-serving public servants. Now, what then is required of you in order to maximize value to the people that you serve? I think the first thing here, and I like the keynote address, is to build two things: to build people, that is human capital, and build the institutions. When you have institutions that are working, it is easier to hold the human capital, to hold the people that are working there accountable. I think the challenge, one of the biggest challenges this country has had is undermining institutions and not building them. We break them. And since we are at a wedding, I don't want to, to go into this that much, but I think it's very important for us to build our institutions, talk of land, talk of investment authority, talk of all these areas of the passport control and migration, all these areas, critically important for the public, for the private sector, critically important for the economy, but we usually do not build the capacities in there. And as you have heard from the PS, only about 67% of staffing is provided for most of the public service institutions. So in other words, the public service is operating at 60% capacity. So that is a challenge. Then holding people accountable becomes a challenge. Secondly, we also need to build a sustainable capacity for all the public servants. And then this is where increasingly we need to build professional capacity. We need to train people. We need to challenge them to new ideas, to be innovative, to be more creative at their areas of service. Okay? And then thirdly, we also need to strengthen management capacities for projects and programs to improve service delivery. Again, most of the projects that are operating in this country or are being implemented in this country are actually only at 50, 60%. A project of 5 years, you get into the 4th year and has only performed up to 25, up to 30%. And the private sector is waiting for services in civil works, is waiting for all these services that are being procured by government. So efficiency, putting detail to performance is critically important for the private sector. Then we also need to cut down on the bureaucracies by digitalizing. And here, I think we need to allude a little bit more on building systems and ensuring that we have e-governance. E-governance is going to be very important. Once systems are working and you have e-governance, then efficiency is addressed. You begin to build efficiency in the institutions that interface with the private sector without us really having to engage you in the public sector physically, because then that would breed corruption, would breed non-transparency in procedures, in processes, and so on. And the last but one is to continuously monitor and evaluate performance of the public servants. And I've already alluded to this through the performance appraisals and so on. The final one is to involve us, and we hope this can be accepted, to involve the private sector and the Public Service Commission. And this would be done through mutual partnership between the public sector and the private sector. And why? I think the idea here is really to help identify talent and the requisite competencies as well as integrity. I think, again, the keynote address alluded to, let us not recruit thieves. You recruit an engineer with a first class, you put them on a site, and these are engineers that are siphoning fuel. You recruit an accountant, put them in charge of money, they run away with money, and so on and so forth. In the private sector, we have paid a little bit of attention to integrity, to the due diligence. I don't know the level of extent which the public service does due diligence when you are recruiting your staff, but we want to suggest that if you have 10 commissioners on the public service, we have about 3 from distinguished business practitioners in town. Because at the end of the day, you are serving the public, you are serving the private sector. Then the other thing, of course, is that we could organize lectures for the public service. I think we have had time to talk about this with the leadership at the Ministry of Public Service. Distinguished business people in town can bring out expectations very loud to the public sector. Periodically, we could have lectures from the business community. What are the expectations of the private sector in the public service? Okay, and these could be organized between PSFU and the Ministry of Public Service. And again, this helps the public servants to understand the detail, the level of detail and level of expectation of the people that they ought to serve. And that goes back to the DNA of the public servant, what is expected. So the next section there, the public service we expect, again lends so much to the keynote address on the DNA of the public servant. How do we profile this public servant to be able to understand that they can be of value to the people that we expect them to serve? So I'm putting it to this meeting and everyone out there that the public service should be for the selfless and most deserving. And I like the address again. It alluded more to this. I think, I don't know who stole the others' notes, but this is the expectation, and I really want to thank Dr. Kayuza for that wonderful research. It was quite extensive, but everything is about morality. It's about the human capital. It's about the mindset of the public servant. Once you have this right, then certainly you will be able to get everything okay. So when the Public Service Commission is recruiting, I think the attention is usually paid to intellectual abilities. However, this is only a bit of the expectation out of the public servant. Being selfless demands a lot from you by way of integrity, respect, and passion for humanity. So one has to be spiritually well prepared. And again, the keynote address alluded to religious leaders really helping out on the soft skills and so on. Emotional set, since you are always in the limelight and interfacing with the public with diverse backgrounds. I think it costs nothing to be courteous and be humble to the people that we serve. If it's police, if it's the tax, the people who are collecting the taxes and interfacing with the business community, it costs nothing to be courteous and humble. But that does not mean that you compromise on procedures and processes. Being humble and courteous should not be, equated to compromising on procedures. We want to pay taxes. We want to abide by the regulations that you espouse, that you should enforce as public service. But I think it's very important to be courteous and be humane when you are doing this. Character and integrity, critically important. Businesses also expect that public servants will not lead a private life. And by this we mean that public servants are transparent and will not hide away anything on moral and professional grounds. And I think we take oath on this. Public servants are expected to live out of their lives and not simply out of their positions. They must live loud. We as business community therefore expect utmost transparency in processes and procedures. And I'll give an example, public procurement. What is the process? How do we tender? How are these tenders managed? What are the procedures, the guidelines, and so on? Do we understand them? So once we can work together and help the private sector understand these processes and procedures, then we will be of value in terms of the services that we offer. I know that the ministry, with the guidance of the head of the civil service, has prepared a code of ethics for public servants, and hopefully these are some of the underlying principles. And again, Dr. Kayuza alluded to this. At least even when you appear to be inhumane, please wear a human face. Systems must be fixed and respected, and to do this, government needs to digitalize in order to avoid bureaucracies and provide for accountability. It is this level of efficacy that will continue to invite investments by the private sector. Because the role of the private sector as against government is simply to lay capital, but we lay capital in areas that make meaning to us, areas that are profitable, that are productive. So if it does not make meaning in terms of business community, then the private sector will not be invited to invest. The expectation of government is is to design policies, laws, and regulations, as well as standards that help the private sector become more competitive. So each time bills delay in cabinet or parliament, we get concerned. Each time projects are not completed on time, we get concerned. Why? Because these further constrain the business environment that we operate in, and they are espoused in the public service, whether at KCCA level, whether at URA level, whether at parliamentary level, so on and so forth. In conclusion, the private sector has very high expectation of the public service because we pay taxes for a public good. We want to be served and served well. To help build institutions, install systems, and train people should be the aspiration of the public service and the civil society. Without the public service, we in the private sector cannot compete, cannot be profitable, or even meet our tax obligation because we want to pay taxes. But we need tax education. We need to understand the procedure of tax payment. We need to understand the tax regime. As private sector, as I conclude, we need each other and let's all remain valuable to one another. I thank you for God and my country.
Thank you very much, Mr. Badagawa. PS, over to you.
Thank you very much, Mr. Badagawa, for honoring us with your presence and for giving us a sincere feedback about what you expect of us. You have rightly observed that we are just about 0.8% of the population of Uganda, and we serve the entire private sector and all those who fall in between. So it is extremely important that we need to be alive to the needs of the public sector. Whatever services we provide, whatever omissions or commissions have a bearing on our economy and where we all fall. So it's extremely important that we get closer. Let it not only stop at this wedding, but we need to get much closer, much closer to you so that we know how to dance together. Because if you have a partner with whom you are not in consonance with, then it becomes difficult to tune yourself to that partner's needs. And that's where, as key stakeholders in government, we need to really, really move much nearer. I have picked something which we need to follow up from here. When we are undertaking an evaluation, a performance management evaluation of government, there's something which we haven't done. The measurement of productivity of the service. We have only attempted at a concept of developing the productivity indices of the public service. And we, every 4 years, undertake a national service delivery survey, which right now has just been hampered by the COVID-19. Otherwise, it should be taking place right now. We should be doing that survey with the help of Uganda Bureau of Statistics. But we need to go further and develop the productivity indices. How much does each sector contribute in terms of productivity? If we remove one parameter from a sector, what is the outcome in terms of productivity? And which are the sectors that are getting very huge budgets, but we don't see the results in terms of productivity? That is a conversation that we need to continue from here and engage EPRC to see that we actually do the research, undertake this research. And then we get to know, do the 320,000 civil servants that we have actually contribute a significant, or whatever percentage it is, to the productivity of our economy? So, sir, we are really grateful. Your feedback is an eye-opener. And coupled with the DNA of a public servant, if we can embrace those two and sell that mantra to the entire public service, that should be one way of establishing the right mindset to deliver to this nation. I thank you most sincerely and appreciate the time you have given us. I know you had a hitch with sound in the beginning, but I'm glad that you're on with us, and it's really a very good occasion. This time we have done it differently. Previously, we have been involving more of ourselves, partner institutions on the side of government, but this time we are focusing on also looking at what our client, private sector, what do they think about us? How are we resonating with them? So thank you very, very much. And I'd like Madame Savia and the entire team out there to give you a huge round of applause for this. Thank you very much. Savia.
Thank you. Asante sana.
Yes, right.
Thank you very much, Madam PS. But I think really the underlying catch here is to say that I think we need to pay a lot of attention at the time we are recruiting the public servant. Because once you have the right seed, it's easier to irrigate it and have the right fruit at the end of the day. But if you don't have the right seed, however much you irrigate it, you'll have a problem with these people. So as much as possible, and I think I want to suppose that the presentation from the keynote is going to really be circulated to all of us so that we keep referring to it. I think all the ideas that we need are embedded in there. Whether you're talking about soft skills, whether you're talking about mindset change, and even words of inspiration. I think the whole presentation has what it takes to transform a civil servant, to transform a public servant into the person that this country is looking for. Thank you.
Thank you, Chair. Maybe Mr. Badagawa, if we have one burning comment or question, I think this would be the right time for you to pick it up. Ladies and gentlemen, whoever has a comment or question, you quickly raise your hand so that we can relay it to Mr. Badagawa. If there is no hand coming up, I want to presume that the expectations have been very clear from the private sector, but I think Mr. Badagawa statistic where he talks of just about 1 million or so. We are not even yet 1 million public servants, but we are serving over 43 million Ugandans. I think that is fundamental and worth the celebration on this celebration day, what we have now tagged the wedding day. That's a fundamental statistic that he puts out there. So amidst all the other challenges and constraints, I think we need to still appreciate we are doing a job, but which can be a good job that can be made better. So ladies and gentlemen, if we have no hand coming through, I want to assume that that has been loud and clear, straight to the point. And among the other key lessons and some of the points of actions we pick up is the dialogue, the continuous dialogue. I think that was raised by Mr. Badagawa. He talks of having dialogue with the private sector and making it regular. That's the only way we can be in sync in terms of what we expect from each other. So I think we pick that up. Mr. Badagawa, I don't seem to see a hand, and I think that was right straight to the point. The issues you raise have been explicitly noted, and I think it is very important that the PS has picked up the issues that we need to run with hereafter. So we want to thank you so much. I hope you can stay with us.
Unfortunately, I have another engagement that I must run to. I'm really very sorry. I must apologize. But I hope to get the report. I hope to get the full report. If I can be able to come back, that would be good.
We appreciate at least you honoring our invitation. Thank you so much.
Thank you very much, Catherine, and thank you very much, the team.
Thank
I
you.
appreciate it.
Thank you very much. Ladies and gentlemen, let's have a 5-minute stretch out. Just pick a cup of coffee, water, and then get back to the table so that we can move into the next session for the day. So can you pick your coffee, your water, stretch out, and go and do the undelegatable roles, and then you come back.
That is whole 7 days. They'll be there in service. I see international bodies. Sabia. Bring on.
And I welcome you to the forum today. Thank you so much. Thank you, Mr. Alvin. Thank you, everybody. I know we all have come together from around the world and to answer some major questions around the global situation of COVID-19. Thank you for the government of Azerbaijan and Hassan and the leadership of the country to bring this forum together so that in order to find out a solution, we are all together trying to understand the problems, first of all, and number two, progress together, collaborate together, and find a common way because in so many ways, and we've just realized it, that we're all connected together. So thank you so much.
We will move forward with the third presenter, Honorable Wilson Mukasa, who is Minister of Public Service of the Republic of Uganda. Honorable Minister, you have the floor.
Thank you very much, Mr. Moderator. At the beginning, let me pay tribute to the Republic of Azerbaijan and the Hassan community for making it possible for this important debate to take place in this forum. It is my great honor and delight to greet you all, and indeed I feel very privileged to be part of the Global Web Forum to discuss the difficulties posed to the public services the quarantine measures and of course the economic lockdown, as well as how governments can achieve user-friendly and transparent services to assist amidst this COVID-19 pandemic. The government of Uganda carried out an analysis that of the factors that could escalate the spread of the coronavirus. And after that, it was realized that one major way of defeating this virus was to deny it large concentrations of people that could infect. Hence, most of the measures the government has taken have been to reduce personal contact. The government was forced to implement the lockdown of all key public services, and His Excellency the President issued 35 directives to stem the spread of the pandemic. With parts of government under lockdown and staying at home, we were forced to find innovative measures and solutions to ensure the continuity of functions. And many of these innovations are based on the following. The use of e-government in the delivery of public services. So we had to develop digital communication platforms, websites, and applications to keep the population updated on the status of the COVID-19 and measures to contain the pandemic for all ministries and agencies. And we are able now to ensure continuity of government business through online meetings via video conferencing. And this means that actually government systems have continued to operate efficiently and to deliver the effective response to the pandemic. And of course, the necessary reduction in physical meetings and therefore reducing the spread of the virus. As government of Uganda, we are convinced that embracing collective responsibility will help us address the recurrent COVID-19 threat, as well as deliver customer-centric public services. I thank you. For God Almighty.
Hello, Dora. Ladies and welcome back.
Hey, where was it?
Ladies and gentlemen, welcome back. And I think for purposes of all of us being in the virtually, we would microphones are muted. Patrick, and you, Dora, so that her microphone is muted. Ladies and gentlemen, as we get to the session, I want to, on behalf of the whole team, I wish to welcome, we were joined by one of the officers of Justice and Constitutional Affairs, Madam Jessica Biona, who are also joined by the Undersecretary for Opportunities Commission, Mr. Sewante, who are also joined by from Barara District. Taking off time to join this celebration of the Africa Public Service Day. We want to thank you for making sure that you are sustaining the delivery of services in the public. Ladies and gentlemen, I now want to take this opportunity to welcome Mr. Edward Walugembe, who is the Commissioner, Policy at this juncture, can I request Patrick, your managing Ladies and gentlemen, if we can get back to the room. Yes, I was introducing Mr. Gembe, who is our Commissioner for Policy Planning, Monitoring and Ministry of Public Service. We have had a meeting where we have been laying ground in terms of the values that we are expected to be working with, the kind of civil servants we are expected to be, but above all, we've also been thanked, especially the frontline staff in the health sector and other sectors that have stood for us up to this point in time. So there's been appreciation for what we've been able to do, how far we've been able to bring the service, but there's also been indication of the kind of public servants that each of us should be. I think I don't have to go over those again, but having laid the fundamentals of what we are expected to be in terms of the person we are as civil servants, having had what the world out there represented by the private sector is expecting of us, it is important for us to get a picture of what the human resource in the public service looks like right now. I think this gives us a basis as we plan forward. We would have the fundamentals, but then the image of what we are becomes important. So at this juncture, I will welcome Mr. Edward Walugembe to take us through the human resource in the public service, and he is going to be highlighting some basic facts about the human resource in the public service. You have heard that the human capital is most fundamental, so we can't downplay, and it is important to see what kind of picture we have in the Uganda public service. Edward, you're most welcome. You have 20 minutes and would expect you to work within those minutes. Thank you so much. The floor is yours.
Thank you, moderator. I want to start by congratulating all public officers on this wedding day. And I want to say that I'm talking about the state of the human resource in the public service, but I've structured my presentation in 3 areas. 1 are the basic facts. 2, adapting to the restrictions in light of the COVID-19 pandemic. And then 3, focusing on the future. As you've heard from Dr. Kauzia and Mr. Badagawa, Mr. Badagawa said that less than 1 million public officers serving over 43 people. This is the structure of the public service. We are talking about a total of 320,000 public officers as of December 2019, of which 62% are males and 38% are females. Majority of these are in the teaching service, 53%. And the least number is government agencies, 1%. So service delivery is done basically at the local government level and in health sector and education sector. But of course, when you look at the entire structure, we can see that the majority are in the teaching service. And we can also see that the Uganda Police Force has got a good number of 13%, but also taking it from the PSC submission, we are understaffed in the public service, meaning that we are employed at 67% of the requirements going by the structure. But if you look at the population of Uganda, you look at 41,000 police officers to the population of 43, that's an enormous bit of work. So you can also see that we have 10% of the public officers employed in district, municipal, and town councils, 4% in the ministries and departments, 3% in the prison service, 2% in public universities, and 1% in government agencies. So that is projected on the screen. Next slide. Next slide. Next, please. This graph has been summarized. Now, looking at the civil service by age categorization, Patrick, we can see that we have a fairly youthful public service with the 117,544 aged between 30 and 39. That's the majority. 40 to 49, 106. The youth, again, we have 29 years and below, 27,000. So 47% of the public service or the civil servants are below 40, 33 are between 40 to 49, and 20% are above 50 years of age. So this gives us an insight of succession planning and also recruitment planning. So you can also further see the categorization by scale, salary scale. The biggest number is 50%, U7, followed by U5, 14.9%, U4 is 14.5%. Those are the operational levels, basically. U1 and U1S, where we have strategic, that's a small number, 1%. If you combine E1 and E1S, that's 1%. So you can see how the public service is structured. We have more action officers than real bureaucrats. That has been done. So there are 7% of the public officers are scientists, are categorized as scientists. 16% are in U1 to U4. 80% the action officers are in U5 to U8. Other employees are 4%. Going to the experience of the public officers, the length of service, length in the service, below 10 years, we have 127,000. And 10 and above, 10 years and above, you can see the number is quite big. This means that from 10 and above, those are pensionable, they qualify to be pensioners, just in case they meet the other requirements for early retirement or retirement. So the issue of wastage, which Professor Dr. Kauzia talked about, can also be factored in as we look at the public service. On the other side, we have what we call the senior citizens, the pensioners. We have a total of 80,777 pensioners. 78% of these are males, 22% are females. And you can see that of these pensioners, 40% are traditional civil servants, 25% are teachers, and then 35% are veteran officers. And you can see also the financial implications per month for supporting the senior citizens. Having looked at the public service, there's another slide. Having done the public service, I'm looking at now the current situation and addressing myself to the theme of African Public Service Day. On the front lines honoring public servants in the COVID-19 pandemic. Members, we are operating in special circumstances, but the public service has tried to ensure that there is business continuity. Several things have been done. The public officers we've talked about have been trying to ensure there is business continuity in the country as far as public service is concerned, public service performance and public service delivery is concerned. Several things have been done. One of them is adaptation. It's business unusual, so to say. We've had a lot of teamwork and networks. We've had, in order to ensure business continuity, we've had to look at information sharing and communication. There has been a lot of self-organization, looking at how we run business, innovation, but above all, the focus is the clients. And we try to maintain service delivery standards in the public service, regardless of the circumstances. In as far as adaptation is concerned, the ministry has tried to guide the service to ensure business continuity by, in line with the standard operating procedures issued by the Ministry of Health, to fight and prevent the infection of COVID-19. The minister has issued various standing instructions, such as standing instructions. And these, I want to categorize them because this is business unusual. There are so many things that have taken place. One of them is flex time. Attendance to duty has to be maintained
and performance, because service delivery remains critical even in these trying times. Now, looking at the guidance that has been issued by the Ministry of the Public Officers, Circular Standing Instruction number 3 guided the service, gave guidelines and preventive measures against COVID-19 pandemic on the 25th of March, 2020. Circular Standing Instruction number 4 issued on 31st March was to do again with additional guidelines to implement government directives on managing public institutions during the quarantine period. This is part of adaptation, ensuring business continuity during that period. Another Circular Standing Instruction number 5, contingency strategy to process pension, salary, gratuity during the lockdown, which was issued on 31st of March, again to ensure that service delivery continues unabated in as far as these critical areas, and as far as these critical areas we are concerned. Then, most important of all, working remotely and telecommuting, working from home. This was issued on 7th April 2020. This was again to ensure that there is business continuity, there is service delivery, there is public service performance, so that our clients don't suffer, so that there are some measures that enable us to serve the public. Number 7, the post-lockdown standard operating procedures for office operations in the public service, which were issued on the 5th of June. Again, these are in line with the national guidelines issued by the National Task Force and His Excellency the President to ensure that there is no congestion and on how we progress or how we continue with service delivery during this period. So this is all about adaptation. It has not been business as usual, and I want to thank all the public officers who have continued to provide services to our clients, or to the citizens of this country, to the 43 million clients in these circumstances. So if you don't adapt, you perish. The public service has tried to be resilient by trying to work in different circumstances, ensuring that there's service delivery, there's performance. Because one of the challenges which you have in the public service, and I want to allude to one of the comments that was made by one of the participants, is that about discipline or enforcing performance. I want to assure you that service delivery has continued in this new arrangement. So the public officers, I think, have adapted, and I think the future is bright. And to congratulate them for continuing service delivery, the frontline officers, the health workers, and so on. So these guidelines have tried to ensure continuity of the business in the public service and to ensure that there are no interruptions to the extent possible. Now, the third part and the last part is the future of the public service, which I must say has been aligned to the NDP3. But of course, this is a continuous process. And of course, I want to say that some of these aspects have been talked about. So I was very pleased when Professor Dr. Kauzia made some comments which have already been made here, and as well as Mr. Badagawa. Now, in line with the NDP3 and Objective 4, which is increased productivity, and my PS has again also talked about productivity, increased productivity, inclusiveness, and well-being of the population. The Ministry of Public Service is aligned to Strategy 4.2, which is institutionalization of human resource planning for the economy. The program therein is human capital development. This program, this intervention, this strategy is trying to improve the DNA of the public service, the DNA of the public servant. So we're on the same page with the Dr. Kauzia. We're on the same page with the Mr. Badagawa in as far as the future for the public service is concerned, because it's not business as usual. So there are a lot of initiatives which talk to this intervention, which talk to this program. These are key reforms. Number one, institutionalization of the public service wide capacity needs assessment in collaboration with other partners, Enabel in particular, development of the public service wide capacity building plan, introduction of e-learning in the public service through the Civil Service College. Now here we are talking about the DNA of the public officers, the DNA of the public service, and this is adaptation. And we've also tried to contextualize the NDP3 and of course our strategic plan and the sector votes to COVID-19 initiatives. Slightly back. To ensure resilience of the public service. So we are trying to ensure resilience of the public service so that business can continue, and of course taking into consideration the times that are prevailing. The future also speaks to objective number 5 of the NDP3, which is strengthening the role of the state in development. I think Tabadaga has left, but he would be very happy to hear this, because this is trying to strengthen the role of the state in development, re-engineer the public service to promote investment. And this is to improve the investment environment for local and international investors. And the program under here is public sector transformation. There are initiatives or reform areas that we've targeted, and as far as the future is concerned. Number one, refocusing human resource management towards talent management. And of course, when you go into this, there is going to be strategic human resource management, because the human resource is the key driver of development. So this is an area which we are focusing on. Re-engineering and automating cumbersome business processes to increase efficiency and productivity. Mr. Badagawa earlier on talked about using E to improve efficiency, and we are in line. Institutionalizing research and innovation, again, to come up with the innovative ways and the new solutions to issues and problems that exist and that will emerge. Documentation and monitoring of service delivery based on service delivery standards, and electronic documents and records management. These are areas that have been looked at in as far as the future of the public service is concerned, and to improve service delivery, to make the country a better place for an attractive place for investors, and of course to achieve NDP 3 objectives, Vision 2040, Agenda 2030, and 2063. Members, this is what I had to share with you on this day, and I want to congratulate all of us on this day of the African Public Service Day, and I congratulate all those on the front line. I submit.
Thank you very much, Edward. Madam PS, I think we are going to have the rest of the presentations coming through, and then we can have a plenary at the end. Ladies and gentlemen, I think those are facts that we needed to pick. You have seen the statistics You have heard what the response has been so far in terms of ensuring business continuity. And the future for us, you see, is really highlighted with the need for us to be pragmatic in our response, the need for us to reposition our service delivery. Those are coming through again. Ladies and gentlemen, at this juncture, the Honorable Minister, the PS Public Service, ladies and gentlemen, we are now going to hear it also from the horse's mouth. We have our key sectors with us. I highlighted at the beginning that in terms of getting this day up to this point, we have partnered with them for purposes of making sure that they give us an indication of what has been happening in the key sectors. We have specifically looked at the sectors, or we are looking at the sectors of education, health, and local government. And with us in the house, we do have Dr. Cleophas Mugenyi, who is a commissioner within the Ministry of Education and Sports. We thank him because he has been with us since we started, and definitely he has a feel of where we are coming from. He will be presenting the highlights for the education sector. He will be talking about the key challenges the sector has had, the key interventions and achievements they have attained, trying to cope during the COVID-19 pandemic, and of course telling us what key actions they are looking at for the future for purposes of sustaining service delivery and ensuring that business continuity is there for us in the education sector. So at this juncture, please allow me to welcome Dr. Cleophas Mugenyi to come and present the highlights of the education sector. Mr. Mugenyi, you're welcome. I hope you're still with us.
Thank you very much, Savia. The Honorable Ministers present, the PS, distinguished invited participants, ladies and gentlemen. My name is Cleophas Mugenyi, Commissioner of Basic Education. I'm representing the Permanent Secretary, Mr. Alex Kakoza, who has not been able to be with us due to other commitments. I'd like to join my colleagues to congratulate all public servants as we commemorate the Africa Public Service Day, and also thank the Minister of Public Service for this opportunity to share what we are doing as Minister of Education and Sports. The education and sports sector is a huge sector that includes nursery schools, primary schools, secondary schools, post-secondary schools, up to universities. As you are aware, we have also been on the front line trying to ensure continuity of learning during the lockdown and making arrangements for the opening of schools. My presentation basically covers 3 areas, namely the achievements, the challenges, and then measures to sustain service delivery. I would like to say from the very beginning that as a sector have been going through challenging times since the closure of schools that was announced by His Excellency the President of Uganda in March this year. Following the closure of all education institutions, the first thing which we did was to put in place a Ministry of Education task force on COVID, basically to coordinate the efforts of government at central level with the local governments and other stakeholders. We have also ensured that there is continuity of teaching and learning using 3 different modes, namely distribution of self-study materials, teaching using radio and TV, and then online learning.
Mr. Mugenyi,
We developed, hello?
Mr. Mugenyi, sorry for the interruption. We would like to see you properly. I think at the moment we are only seeing the tip of your head. That is better. Thank you very much.
Okay, thank you. The ministry developed and distributed self-study materials to all learners from primary 1 to primary 6. Given the fact that we have about 10 million learners who are only able to cover 25% of these learners from primary 1 to senior 6. We also developed and distributed the parents booster in order to support the parents' participation in the continuity of learning during the lockdown. We received support from proprietors of private radios and TVs by way of offering free airtime for media learning and continuous sensitization of the masses and the learners on COVID-19. The First Lady, who is also the Minister of Education and Sports, wrote to the proprietors of private radios and the TVs asking them to also make a contribution by providing free airtime, and we are happy that they were able to provide this airtime. We have worked with development partners coordinated by UNICEF to supply up to 100% self-study materials to about 34 local governments which are under the Quality Enhancement Initiative. On a happy note, I would like to inform the participants that our application to the World Bank for a grant of $15 million was approved, and this money is going to help us to support continuity of learning and also the opening of schools at the appropriate time. The availability of online materials has been a very big boost during this lockdown, especially to learners in higher institutions of learning and those who can access the internet, so that they are also kept busy, while those who have no access at least have self-study materials and also revising the notes that they collected from school. We have had very wide consultations with a number of stakeholders, ranging from faith-based organizations, educational partners, head teachers of primary and secondary schools, university vice chancellors, and NGOs in developing guidelines for the opening of education institutions. To make sure that the learners at the lower primary level and the ECD centers are covered, we have also promoted teaching in local language, which is being done in over 20 radio stations with support from our development partners. Those are some of the achievements. I would like now to quickly move to the challenges. One of the most outstanding challenge is the safety and security of learners during this lockdown. Colleagues, you must have read from the media, there has been an increase in sexual abuse, early marriages, teenage pregnancies, and obviously the spread of HIV, stroke, AIDS. That remains a very big challenge. The other challenge is inadequate support to learners with special needs education. As you know, these learners are currently living with their parents or guardians who don't have the special skills to support them. So this is another big challenge. Follow-up and monitoring of the use of the self-study materials, given that there is restriction of movement, it remains a challenge. And because of the high cost of media learning, especially the high prices of private radios and the TV, the ministry has not been able to ensure continuous teaching and learning. We have been able to do this only using UBC, and yet UBC does not cover the entire country. The other challenge is the non-payment of salaries for teachers and non-teaching staff in the private education institutions. As we all know, the source of funds for the private institutions is school fees, and during this lockdown, they cannot be able to pay the salaries to teachers and non-teaching staff, and therefore their survival is a very big challenge. Propaganda and the fake news on the position of the Minister of Education regarding the opening of education institutions remains a challenge. Every other day there is something being put across, and yet it is not genuine information. Because of what the country is going through, we have not been able to provide adequate psychosocial support to teachers and learners, especially those that have been affected by COVID-19. Paradoxically, most of the parents have also not been helpful in fulfilling their roles, especially in supporting their learners, even when the government was able to provide the self-study materials. There is also a very outstanding problem, as I've already alluded to it, lack of clarity on when and how education institutions may reopen. And this is creating a lot of anxiety and fatigue. Because of the continued lockdown, there's a destruction of school infrastructure and the facilities due to negligence by the leaders of these education institutions. The PSC did issue a circular requiring all heads of education institutions to keep at school and ensure that they protect the infrastructure and the school facilities. Unfortunately, especially in primary schools, this is not being adhered to. So when you visit some of these primary schools in the rural areas, the school compounds are now grazing grounds for cows and other animals. As I move towards the end, I want to briefly talk about the measures for sustainable service delivery. We have continued to mobilize and sensitize the community using both TV and radio on mitigation and control of COVID. We developed and we were continuing to develop and disseminate home learning materials because, as I mentioned, the first delivery covered only 25%, but now with the funding from the World Bank, we are going to cover all learners and ensuring that we are covering all the material in the syllabus for primary 1 to senior 6. We shall continue to expand remote learning opportunities for learners and teachers during this time using the radio and the TV. We also intend to empower the teachers in the partnership with Ministry of Local Government to remain in touch with the learners and the parents to support continuity of learning. And we are planning to issue another circular to ensure the presence of head teachers and principals at all education institutions. To ensure that to ensure the safety and security of the learners, we shall continue with regular communication from both the technical and the political leadership of the ministry to all education institutions. We do hope that we shall again work with the Ministry of Local Government to support the local council authorities to develop village registers of school-going age and teachers to ensure effective monitoring and follow-up for the continuity of learning. We also wish to support monitoring of continuing learning through quick sample-based assessment. For example, we did distribute self-study materials, but we need to find out whether the learners are taking advantage of it. We are doing teaching on TV and radio. We also need to find out whether the learners are listening in or they are actually following whatever instructions are being given by the teachers. For example, there are cases where they are being given some work at the end of the lesson on radio or on TV. So it would be important for us to get feedback. I want to thank you for this opportunity. Thank you for your kind attention.
Thank you very much, Mr. Mugenyi. I think that was quite informative. It is a sector that is close to our hearts. I think for all of us who are here and who may not be part of this forum, That is a sector that is close to our hearts, and I am sure there will be a number of issues that will come up. You have highlighted them in your presentation. We will be looking also, we will be waiting to hear from you about the illiterate parents who've been doing the support during the self-study, and the children have been telling them, no, that's not how they teach us. And it has become very difficult for them to be supportive in the entire process. But we will later hear from you what your plan is for such parents. So at this juncture, I would now like to call upon Dr. Sarah Biachika, who is the Commissioner for Health Services, Planning, Financing, and Policy under the Ministry of Health, to also come and give us the perspective of health. That has been one of the sectors that we live on each day, but it would be important to hear from them what are the challenges beyond what we see, what they've been facing, the interventions and achievements so far. Some are already self-exhibiting. We see some of the achievements already, but it would be important for us to hear from them as a sector, and also how they intend to sustain delivery of health service as a sector, because you all know that there has been a lot of attention on the COVID pandemic, and there's been a concern about the other areas of health that seem not to be given attention because of the pandemic. They seem not to have the attention that they deserve. But Dr. Sarah Biachika will give her highlights, and we'll be able to see where the health sector is headed. Dr. Biachika, you're most welcome to address the participants. Thank you very much.
Yes, thank you, all of you. And once again, good afternoon. And I also join the others in congratulating you on commemorating the Public Service Day. I am here to presenting on behalf of our permanent secretary. She sends her regards. She was really busy, but she asked me to step in for her, and I hope I'll be able to ably share some of the issues that were requested for us to present. As you are aware, the health sector more or less is the lead organization as far as the response is concerned. So we have quite a lot to share, or a mouthful to share in terms of the experience and challenges related to the COVID-19 response. So I'll start by talking about the key health sector challenges. And in terms of preparedness, we have, following the 7 containment measures, which include the lockdown, which was declared by His Excellency. We are social distancing as an intervention, hand washing and sanitizing, wearing of face masks, surveillance and laboratory services, quarantine and case management. I'll share what we have done across all those and some of the challenges so that we have a better understanding of the response. For purposes of key interventions within the sector, we further broke down our response in terms of the response pillars covering aspects of leadership, stewardship, coordination and oversight, surveillance and laboratory, case management, strategic information, research and innovation, risk communication and social mobilization. We have community engagement and social protection, logistics, and then continuity of essential services. So when COVID was declared as a pandemic, that was way back in January by World Health Organization, Ministry of Health team sat down and started preparing. And so in this, we first came up with a draft preparedness and response plan, which was short, about 6 months, thinking like other pandemics like the SARS, the COVID would come and probably within 6 months, it would have been contained. But that has not been the case. So we reorganized ourselves and have now developed a more comprehensive COVID-19 preparedness and response plan, which runs from March 2020 to June 2021. And this is to provide a national framework for coordination and control of COVID-19. I would like all of us to note that the implementation of this plan is multi-sectoral. That is, it is involving all the relevant ministries, departments, agencies, development partners, NGOs, private sector entities, and other stakeholders. As you have all seen, everybody has come up and supported this response. We have a national response structure, and the overall, as you know, the president has taken leadership in this. And we have a national task force, which is chaired by the Prime Minister. Within Ministry of Health, we have a strategic level structure where we have the Minister of Health chairing this. And then we have other technical structures that are guiding the response. But we also know, this being a pandemic, we also have cross-border engagements with our neighboring countries, and we have the Director General Health Services taking lead in those cross-border communications and engagements. We have almost many of the departments within the Ministry of Health involved in the response, but the core team is the incident management team, which is also multi-sectoral and is taking lead in the day-to-day response activities. We have community engagement and social protection as another key pillar, and which will have to be strengthened as we go forward. Then we have the management supports and support services, as well as continuity of essential care as another component. We know our major role was provision of essential care, but because of the pandemic, you know, all efforts have been redirected towards responding to COVID. And so, but we cannot forget, because the majority of the population need the essential care services. So we have incorporated it all within the response structure for COVID-19. So under leadership and coordination, in addition to the plan, we have developed a number of materials, IEC materials, guidelines, standard operating procedures, so that the health workers, but also other key players, have guidelines on how to respond to this pandemic. We have recruited up to 546 contract staff of various cadres to enhance our human resource capacity for the response, but largely we're focusing on key cadres that are not really available within our structures. That is the epidemiologists, critical care nurses, ambulance assistants. We needed more psychiatric clinical officers, and anesthetic officers are in the structure but are lacking. They are not yet absorbed. And call center agents, because we had to expand our call centers. And in order to really motivate after the lockdown, you know, essential staff had to be called back, but also the health workers plus all other staff from other MDAs were called upon to participate in the response, facilitated with a hardship allowance based on the work done or the extent of procedure. And we are actually grateful that Ministry of Public Service was able to provide guidance on how to handle this. And we have had to digitize a number of our response processes, including communication. We do hold many daily meetings for the different pillars, the National Task Force members and other stakeholders. And actually, we have already adapted the Zoom meetings. We also hold Zoom meetings with the district health teams, our regional referral hospitals. So that is a development that has really come up with COVID, and also many of our data management processes, because we need timely data, we are really digitizing them. To ensure transparency and accountability as well, because many resources have come from different partners. Some are on budget, others are off budget. We have developed, with support from our partners, a budget tracking tool that shows the type of funding, how much, and where actually it is targeted. For example, if it is going to a district, we know that these kind of resources, either in kind or financial, have been provided, and by whom to this specific district. And in addition to our plan, we have in place an M&E framework with clear output indicators for all those interventions that I highlighted above. I mentioned another key pillar that is supporting the response, and actually is core, is the surveillance and laboratory. So immediately we did conduct training of the national and district capacity health workers on surveillance reporting. This covered the National Task Force, Incident Management Team, district task forces. All those people we are involved in, and selected village health teams have been trained to be able to do surveillance. Surveillance includes contact tracing. If there are any suspects or rumors, any alerts, people have to actually go and visit those homes, get in contact with those people, take the history, and determine whether they are a likely suspect, and if so, they take off the sample or take you to an isolation center. We have trained the laboratory staff to take off the samples, package them, and transport them to our testing labs. And also, we are able to do a first community risk assessment for COVID. That is to determine whether there were any community transmissions in May, and we are planning to undertake another community assessment. So as you know, our biggest challenge now for COVID is the people bringing COVID from outside the country. We had succeeded when the airport was closed. Then immediately we realized that the border points of entry were the next area to address. So all our 54 official border points of entry have surveillance teams with designated people on a 24/7 basis to conduct surveillance activities. But because we did not have permanent facilities there or structures, we've had to actually engage some contract staff and volunteers to support our surveillance activities there. And we do give them a hardship allowance, plus some training, facilitation, and also some meals. We've also had to provide or rent accommodation for some of our staff, of these staff who are working at the points of entry, to be able to accommodate them near the points of entry to be able to work. Now, as I talk today, we have so far, yesterday, we were able to again get 19 Ugandans as positive, and probably are all aware, we have now opened up and we shall be receiving returnees via the airport, our fellow Ugandans who were stranded because of COVID. And so yesterday we received some people who returned, and 11 of the 19 who were positive yesterday were among the returnees from Entebbe, via Entebbe Airport. We also had 8 people who were positive from within the country, 7 from Amuru, 1 from Chotera. None of the Ugandan truck drivers was positive. And then yesterday also 25 foreign nationals were confirmed at the borders. But as you are aware, once you are a foreign national and you are positive, we do not allow you to enter. So all those 25 returned to their country. But also note that 2 of them were from the flight crew from Entebbe Airport. So COVID is still a challenge as we open up, and we need to strengthen our surveillance. We need to maintain our isolation of the returnees so that we are sure that we do not have community transmission for COVID. So as of this morning, we have a total of 889 confirmed Ugandans. But as I mentioned, we also do test those foreigners, especially the truck drivers as they return, but also refugees. So, so far we have 1,200 confirmed non-Ugandans whom we have tested here in Uganda, but they do return to their countries. The refugees obviously are not able to return, so we have to manage them in country. This is an epidemic curve which shows the red. I hope you are able to see the presentation. The red is the Ugandans and the gray, yeah?
If you could kindly share the screen. We don't see what you...
Sorry, I had forwarded.
Oh dear.
To the person.
Sorry about that. If you can share, well and good. If you can't, then you just speak for it.
Do you get it now?
Yes, we do. Thank you very much.
I'm very sorry. I thought you are following through. So the red is the Ugandans, and the non-red, the gray are the non-Ugandans. And you can see that as time goes on, the curve is still growing, and we are not yet done with COVID. We still have to maintain our response activities. Sorry. Yes, I would like to also, since today is a day we are talking about public health, public servants or public officers, we have recorded 17 cases among the health workers out of the 889 Ugandans involved in the registry were non-health workers. 2 of them were truck drivers. We do have support services, including transportation of supplies. So some of the people we engaged were truck drivers, and then 1 OPM driver. We are yet to establish some of those contacts, how they got that COVID. And then from the health workers, 3 were from direct clinical health workers, 1 from Elegu point of entry and 2 from Lira Regional Referral Hospitals. Then 7 were Ministry of Health headquarters staff, because we do deploy our teams to go and support the border points of entry. So it's likely that there was some issues there, and 4 were from KCCA staff as public servants who have got the COVID. So as you can see, 13 of the 17 cases were from Kampala, 1 from Busia, 2 from Lira Regional Referral Hospital, and 1 from Elegu point of entry. The ones from Elegu and Lira are the ones who are actually in direct contact with confirmed COVID-19 patients that you could easily track, contact their contacts, but the others got it through exposure, but we are not able to establish the actual source. So we need to really see. So that is the range. You could even see the specialty of the health workers, 2 doctors, 1 nurse, then the rest, accountant, human resource assistant, auditor, pharmacist, casual laborer, administrators, are the ones who have got the COVID. So the post causes for our public or health workers, the people who have been in the response support, could be most likely workplace exposure due to non-adherence to the PPE use, but also multitasking among health workers leading to exhaustion that can lead to faltering in the use of the PPEs. High influx of COVID-19 patients is likely to have happened in Lira because they were not yet experienced in management. Then all of a sudden, we know that that week they received so many patients, and that could have been some slip in the PPE adherence, and then limited social distancing. That is it for the health workers and the cases. In terms of case management, we have enhanced the country's capacity for management of COVID-19 through training of case management teams at all our referral hospitals, because those are the treatment units. We have also enhanced capacity for mental health and psychosocial support because of the stigma and stress associated with COVID. So we have a strong mental health and psychosocial support component, strengthened infection prevention and control, including water and sanitation hygiene in all our health facilities, as well as one of the key control measures. We are in the process of procuring 109 ICU beds and 3 oxygen plants and gas cylinders. These are very, very critical. We have been lucky as a country as yet. We have not yet received what we call a severe or critically ill COVID-19 patient who requires ICU units. But we do not want to take chances. As the numbers increase, we have to be prepared and have no excuse. But this is also an investment that also we as a sector are benefiting in the long run, because this investment will not go away even post-COVID. We still need these services, and we shall utilize them. We are strengthening the ambulance services for efficient referral of COVID-19. We have trained ambulance teams. We are in the process of procuring 37 ambulances, which should be in the country anytime. And we hope that once this is in place, it will also help to strengthen our services. So in terms of case management, we have so far admitted a number of patients in our 17 treatment sites. These are largely referral hospitals. And as of today, we have 182 admitted. Since the epidemic, we have had 1,001 admissions in total. Bed capacity in those referral hospitals is 861 beds. And as of today, there are 680 beds which are empty but ready for COVID. And also 819 patients have been discharged so far with no death. Next slide. So all our referral hospitals, this is to mention, have at least been able to manage a COVID-19 patient, which is good in terms of capacity building. But Mulago, Entebbe, Gulu, and Masaka have had the highest numbers. But you can see even Moroto, remote and far away as it is, has been able to manage 2 COVID-19 patients. We had one in Ajumani, which is a general referral hospital. So this is capacity building, in that at least all our hospitals have the human resource who can ably manage COVID-19. For strategic information and innovation is another critical pillar, where we've developed a data management framework for COVID-19, and we receive daily reports. These include situation reports, weekly reports, all kinds of information products have been generated to inform decision-making and policy. We have adapted technology for surveillance data capture and dissemination. We are using the ODK app and mobile phones to be able to report and alerts and follow up patients. So on a daily basis, we have updates and data, and we know who has reported, who has not reported. If there's an increase in calls, we know and we follow up. We've procured computer and IT supplies for the border points so that they are also able to handle the patients fast enough. I mean, to handle all the people who pass through and screened fast enough, and also be able to print the certificates that they have their blood taken off for testing. And we are supporting operational and scientific research, but also we need to continue with promoting creativity and innovations for COVID, as it may stay for longer than anticipated. So that is just to show you some of the apps. Like yesterday, using the ODK, we had 63% of the districts reporting on the situation of COVID, and the alerts, and 93% of the alerts were actually tested. So we are really on the ground. And we are yet to have over 90% of districts reporting. We still have some challenges. Some districts seem to be a little bit now complacent because probably they have not received any positive case or something like that. So there's some level of complacency, but all the border districts are actually active and reporting, and the high risk districts, but this is something we need to follow up. In terms of research, we have a scientific committee in place in collaboration with Makerere University. We are promoting research, for example, some vaccine trials, use of hydroxychloroquine. Those are some of what some of our scientists are undertaking, and also creativity in terms of seeing if we can have locally produced test kits. That's kind of research which is ongoing. Risk communication is critical, so we developed EC materials in collaboration with Ministry of ICT and National Guidance and private sector. We are undertaking public awareness through mass media, social media, distributing IEC materials. We had to expand our call centers and also had private sector supporting us with the engagement of more people in the call centers. We have developed guidelines that can, and key messages for village health teams through community sensitization, and we have procured 3,000 megaphones for the VHTs so that we can enhance community sensitization. These are the call center. For example, on a daily basis, for the last 3 days, we have been receiving from our call centers, different call centers. As I said, we have private sector support as well, Airtel, MTN, UTL, AfriCell. They have provided some support in terms of call centers. For community engagement and social protection, we have established a data and management and reporting system for our quarantine sites where we have suspects. Those are being managed as much as possible close to the community until we have proved they have been isolated for 14 days and we have tested and they are negative. That is when they return to the community. So we have developed guidelines for those quarantine sites, and we do provide food, beddings, and basic needs to individuals in the quarantine sites. And now one of the national undertakings we are doing is to distribute community face masks for the 33 million Ugandans. So we are working on this in collaboration with other sectors like Ministry of Gender, Labor and Social Development, with the districts, that's the local government, with other partners. And also now with Ministry of Education, we really, as the schools prepare to open up, we need to build their capacity, we need to develop guidelines, but also for other work institutions, public places, and all those, we are working closely with them to make sure that the idea to the guidelines and standards. Just a quick one, for example, before COVID, hand washing with soap and clean water nationally was at only 34%. But by May, this had increased to 86%. And we are yet to analyze our data further, but because of time, I tried to summarize this. We have actually noted a reduction in some of the diarrheal diseases, and this could be attributed to the hand washing practices, but we shall maybe at another time demonstrate more of those statistical benefits. And also because of hand washing, this has promoted local manufacturing of sanitizers and other hand washing facilities for the public. And many of the public places have adopted this. And our prayer is that this is sustained beyond COVID-19. So I talked of quarantine sites. We have a total of 74 quarantine sites, and up to majority of them are up country. And as of today, we have up to 1,271 people who are in quarantine. That is by yesterday from 48 districts. Now, the last pillar is continuity of services. And when the lockdown was declared on March 24th, we had closure of entry points, schools were closed, congregation places, curfew, and freezing of transport. And this had an effect on the healthcare. Healthcare workers could not easily access their workplaces, and few had to go long hours, while others shortened hours so that they can catch up with the curfew time. And so this led to some stress, exhaustion, and absenteeism of some of the health workers. We could not undertake outreaches, and this has largely affected immunization coverage and implementation of child health days, which is a national activity every 6 months. And our results or analysis from the HMIS shows outpatient attendance for the same period in the last year decreased by 13% and inpatient by 20%. So in terms of utilization, there's a drop in utilization, but one needs to study and understand the cause of this utilization. It could also be due to underreporting, as we have had also challenges in not all facilities we are reporting in time. So this is an area that was the preliminary analysis, but it is an area that still needs further study. We established a multidisciplinary committee to ensure continuity of services. We have had to revise patient flow mechanisms at the health facilities to minimize COVID-19 spread, because you cannot know who has COVID-19. So we have to have social distancing at the places, but also some kind of triage. If you have some symptoms of COVID, then you do not mix with the other patients. We have had to redistribute staff within the treatment units, that is at the referral hospitals, to ensure uninterrupted essential services. Because once a team is constituted as a COVID management team, then it is isolated from all the health workers. They don't even go home. We have to find accommodation for them, provide meals for them, and they have to stay confined also like the patients. So this has had some also effects, stress and social challenges on our staff, but they have persevered and have been able to manage the patients. We have provided PPEs and infection prevention and control materials for all our health facilities, although there are inadequacies. So we have provided guidelines on which type of PPE to use and when. And in order to reach our patients on chronic care like TB, HIV, and other conditions, the programs have adapted some differentiated service delivery models. For example, having somebody to deliver medicines to their homes if they cannot come to get their refills, follow-up or outreaches, so new methods to increase access, because some of them were coming from far and the district, and there was no transport. So they have had some initiatives, especially with support from our partners, to make sure that the patients do not miss their medications. So we also have worked closely with other sectors, Ministry of Local Government, Gender, to ensure continuity of essential services, because our primary health care services are under, because of decentralization, they are under the local government. So in terms of guidelines, in terms of monitoring, we have to work together, and we have been working closely in ensuring that the guidelines reach guidelines from Ministry of Health are also communicated through the Ministry of Local Government. And we've also had a lot of private and partner support. For example, transportation of patients. Some of the private sector have provided buses to transport. During the lockdown, they provided buses that were able to transport our staff to and from work on a daily basis, especially for the big hospitals. You'll bear with me as I come to the end. Key challenges: we've experienced stockouts of supplies, including the test kits and PPEs, and this has, as you've heard, been an outcry once in a while. Lack of key services and medical equipment like ICUs and some other equipment which are mandatory for management of severe and critically ill patients, but we are glad that probably by end of July, all our ICU equipment will be in place in these referral hospitals, and so we'll be more prepared in case of any of need. Understaffing is a major issue across the board, but with very glaring gaps in specialists, emergency and critical care nurses, and this has resulted sometimes in overwork and task shifting among nurses and doctors, and this has obviously implications on the quality of care or quality of services. We have seen issues of stigma and trauma associated with COVID, and this has resulted, and thus the need for increased psychosocial support providers to both patients, but also to the staff. Yesterday, I saw in the New Vision, one of our key doctors who was also sharing his experience, how his family was shunning him because he's one of our lead doctors in the management of COVID. So such our staff need really also support, psychosocial support, even their families need to be supported to understand, but also they need to be protected. Then delayed availability of transport. All these 9,000 people I talked about who have been in our quarantine site, once they are discharged from the quarantine site, we must ensure that they return back to their homes. So we have to transport them back to their homes. So our vehicles are ever up and down on a daily basis. Once you are discharged from a quarantine site or from a treatment center, you have to go and you are resettled. You must go with the psychosocial team to talk to the community and your family members to take you, to really have you settled in back home. And as the numbers increase, and you are aware, the financial year ended, the funds we had were for the ending financial year. We are now have to care for our patients and who are in admission, and our hospitals are running out of meals. So this is an area that we need to quickly address. Probably Ministry of Finance will come in to ensure that the patients are provided for. And these operational costs, obviously, as the numbers go up, will be a challenge and a burden, because we have to provide more beds, more beddings, operational costs, and all those for the patients who are both in isolation, but also under treatment in the hospitals. So what are the key actions for us to sustain service delivery? As we know, COVID is a disease which has come until we find a vaccine. It is still a challenge, but we should not forget as a health sector and as government that we also have to provide the essential health care services. And so one of the areas as a Ministry of Health is to prioritize health promotion and disease prevention to reduce the burden of preventable diseases and hence save resources for some of the critical care needs. For example, the public health emergencies like COVID, which are coming up. So to this effect, we are looking at having a multi-sectoral community health program and strengthening the community health workforce. This is really essential. And since we are addressing this public service is really hearing us, we need to really work out modalities on how we can have a motivated community health workforce to support our community health promotion and prevention programs. We need to build capacity for infection prevention and control and water and sanitation and hygiene activities at community settings, including schools, workplaces, institutions, public places, commercial places, and everywhere, so that we sustain these gains. We need to build capacity for effective mobilization of local NGOs, religious leaders, cultural, and other stakeholders for community engagements if we are to succeed in the community health program. Human resource, I mentioned, is a challenge. So we desire that more health workers are recruited and training of the critical specialized human resource for health to operationalize the newly built and upgraded national specialized hospitals and our ICUs in the regional referral hospitals. We need to improve the emergency medical services and referral system and establish regional ambulance call centers, as well as train emergency medicine and critical care team. We have to establish outreach mechanisms and differentiated service delivery models to ensure continuity of service delivery, and also government to support the local manufacturers to boost capacity in production of generic medicines and supplies. And this will help us to reduce on reliance of medical imports. We cannot run away from digitization. I think as a public sector, we need to embrace, and as a health sector, we are actually embracing digitization of our national health information system so that we have an electronic medical record system that can track us up to the can track the users up to the individual level. Ensuring adequate supply of PPEs and proper healthcare waste management. Then I've mentioned this production, local production, but also for sustainable health financing, introduction of prepayment mechanisms like health insurance to enable all Ugandans contribute and access health insurance. This will help us increase the available resources for high impact public health interventions instead of focusing on curative services. Thank you and for this, and health is wealth. That is our motto as Ministry of Health. Thank you.
Thank you very much, Dr. Biachuka. Ladies and gentlemen, I think you will agree with me that Dr. Biachuka has been given the time she's been given because this is a critical sector and we are all banking on the guidance that we get from this sector for our health. Like she ended, health is wealth. Indeed, it was important that we hear where they have been and what the future looks like. Chairperson, Madam PS, I am reliably informed that local government should have been presenting next, and the PS is supposed to be joining us to make some remarks. I'm not sure whether he's already on board. But if he's not on board, Madam Chair, with your permission, I was thinking we could quickly pick questions relating to the education, health, and the status of human resource in the public service. Those three presentations, we could pick questions as we wait for the PS local government to join us and make some brief remarks. Chair, back to you for your guidance.
Okay, thank you very much. Our dear presenters, Dr. Sarah Biachika and Cleophas Mugenyi. I think we can proceed. I know that Ministry of Local Government right now is in the almost last minute arrangements for the launching of the cities, and there are still so many issues that they are grappling with. So I hope they will not be bogged down. Let's keep hopeful so that they'll join us later. Otherwise, we are grateful for this presentation. I'll give my remarks later. Savia, back to you. Proceed, Savia.
Thank you, Chairperson. I'm told by the technical team that Mr. Kumumanya is online, so you probably may wish to invite him to make his remarks.
Yes, let's go ahead. PS, Mr. Ben Kumumanya, you're very welcome. PS, you're welcome. I don't know whether I'm not seeing him on the list. I'm not seeing him on the radar. Yes, you're very welcome. And we have had the fruitful discussions and this morning, and we are only waiting for you to come in and give your remarks. Thank you. Over to you.
Yeah, thank you very much, PS Minister of Public Service. Like you already mentioned to the members, the timing was very unfortunate for us. We are just involved in a number of things. In the recent period, we have been able to offload to the country 15 new cities. 7 of them are effective tomorrow, so we are in the final touches. We have also offloaded the 135th district, and this is Terego district, and this one also is becoming effective tomorrow. And we are also in the debate for, again, trying to address some of the other services linked to constituencies and counties by actually having another 15. Now, what does that mean to us in the public service? It brings advantages, but it also brings challenges. First and foremost, our mandate and docket prescribes that we must coordinate the issues of decentralization. And decentralization was captured in the Constitution of 1995. And I always want to refresh our minds the provisions of Article 176, 2D and E. But most importantly, 2E provides that appropriate measures shall be done to enable local governments to plan, initiate, and execute policies affecting their people in their jurisdictions. Now, this one gets translated later in Section 95 of the Local Government Act, which provides that the minister responsible for local government shall coordinate all matters of local government. And therefore, when a local government says we have challenges, for example, we need an additional constituency, and they justify that because of administrative factors, size, geography, and other factors, and they forward it to us, we have to carry the burden using the law. And that's why I mentioned that this has been keeping us very busy. But I must congratulate you upon consistently and religiously observing this day of the public service, because it refreshes our minds to go back and appreciate our role and contribution to the development of society, socio-economic transformation, to service delivery to our population. Now, as a Minister of Local Government, we are doing a number of things in addition to that one, that we are putting ourselves on the line, fulfill, and this one I would want to bring it to the attention of the listeners. For example, we want to commit ourselves to operationalize the parish model. Why the parish model? The parish model, one, is the last line of government. When you look at government infrastructure from ministries to districts, you go down to sub-counties, and the last line is parish level. And we think, and it has been approved, that this is the level where if you concentrate capacity for planning, capacity for governance issues, consultation to the population, picking their views, then you will be able to mobilize the right information that can be sent up to the highest level of government, which is represented by cabinet or line ministries. So we are committed to that one, and we think that one will also help in improving service delivery at the local level. The other issue that we are committed to do now, which also will help public service, is the fact that we are operationalizing what was done in 2006. That decentralization cannot stop at governance, cannot stop at office bearing, cannot stop at disseminating government policy, but must also participate in generating local economic bases. And this is what we call local economic development. Our vision is that we don't want local administration units. In any case, that's why we have been suffering as consumptive. We have been being named that we are just public administration costs, but now we want to cross the line to local economic units where we want to support production and productivity value chains using our governance structures to be able to deliver improved household incomes, to deliver a very strong local economic base. I wish to also inform viewers that the Minister of Local Government, in its mandate and docket, is the one that has the highest linked infrastructure. As already mentioned, from Workers' House where I'm sitting now, I can within a matter of hours talk to a parish chief in Nablatuk district or Ntoroko district, because there is a whole vertical chain that if you get to a cow will get you to sub-county chief, a sub-county chief will get you to a parish chief, and a parish chief will get you to a voter or to a person who needs the services. And therefore, we are calling upon all our sister MDAs that for us to reach the population and deliver public services to them, we need to work together and always share visions, ideas, innovations. And once those are shared to us, we can do a very quick transportation to make them reach wherever they are destined for. And this one, we captured it very nicely, even in our Local Government Act, because Section 96 and Section 97 of the Local Government Act provides for very clear roles of MDAs, which they can do to support local governance, public service, and local economic development. And one of the most important, and the Minister of Public Service is doing it a lot, is the question of consistently and constantly developing minimum service delivery standards through circulars, through letters, so that the MDAs and other actors can keep communicating to our people on what is on the agenda. This is the same reason why in the last 2 years, as the Minister of Local Government, we have been holding meetings with accounting officers in the local governments, but we also cross the line and would invite in sets the heads of departments in the local governments would set or team DOs and DHOs, production officers and commercial officers, the PHROs in service commission and in the mainstream, engineer, those district engineers, we teamed them with the secretary for works. These are the elected people. And we have been calling agencies and MDAs to come and talk to them, take advantage in one roof, under one roof, communicate the current reigning regime of policy status of particular MDAs. So I want to assure you that we are ready to work together, to move together, to ensure that our contribution as part of the public service has meaningful, appropriate, and responsive impact and returns to our population. This is what I can communicate off cuff, because I think I was arrested by my team as I was actually heading to Parliament for another debate. I thank you very much, Madam PS.
Thank you very much, PS. We are very honored that you have taken time off. I know what is taking place there. There is a lot of fire. However, before you leave, there was one question. Why is it that funding for the new institutions, the municipalities and the counties, why is it that there is no funding for them? Parliament pronounces itself, then when it comes to implementation, there is no funding, but these institutions are expected to kick off. If you can just answer that one, then we'll let you go.
Thank you very much. One, apparently we don't have municipalities which are not funded. That one is not a problem. Now, we have had the lower units, what we call the LC3s, the sub-counties and town councils. They were created, but they came in at a time when they were what Minister of Finance, Minister of Finance has always two paragraphs and they use them interchangeably. One of them macroeconomic factors, another one is resource constraints. So I think when they came, those two paragraphs were very, very, very adequately available, and that's what we have been getting. But last year, before COVID came in, we had already agreed to get resources for those units, but COVID came in, and now the current position is that through budget adjustments, which are normally operationalized through supplementary schedule number 1 and 2, we shall get resources for those LOC3 units which have not been funded. The same story is that for cities, we had already secured a certificate of financial implications, which is commitment and evidence of funding. But we didn't get approval until, I think, late April because of COVID and other challenges. But at approval, again, it was agreed that during the budget adjustment for supplementary schedule number 1, we will get the additional resources for the cities, because we wanted about 140 billion, already have 100 billion in totality, but what we want is about 40 billion for all the 7 cities. So we already have an administrative framework and an agreement that we shall get resources along the way for financing the cities. So we are ready to start and move on. And maybe the biggest challenge, which I have been struggling with the Minister of Finance, is the wage provision. My position is that you can't do anything if you cannot provide wage 100%. And I've been pegging it to particular areas. You cannot expect returns and results from the education sector if you have not dealt with the wage bill for that sector. You cannot do the same with Minister of Health. But even most importantly, Minister of Finance has been talking about accountability. But I've asked you for funds for the internal audit units. I've asked you for funds for the finance department, most especially the head of finance, because the only chartered accountant we have in our structure is the CFO or Chief Finance Officer. You want accountability, you want financial reports, but you don't want to get me money for the Chief Finance Officer who can organize that document. I am happy to report that, having made a lot of noise about that matter, recently, Minister of Finance made a circular that all districts, you must ensure you recruit head of departments. So that's why, to me, the glass is half full, not half empty. Because I have been emphasizing that I need One, the 9 heads of departments in local governments. I need the 9 heads of departments are conventionally known: production, commercial, community, CFO, DHO, DEO. And then I want 4 heads of departments, namely the head of human resources in the mainstream, the Secretary District Service Commission, the head of internal audit, and head of procurement. To me, those 14 are a must. But I also need every sub-county to have a sub-county chief who is the accounting officer, head of administration. And I need to have a parish chief. And I must report that in the last 2 years, we have made strides. We have added 15, 20% on what we had in 2017. So the glass is half full. And I want to assure the viewers and listeners that we will get there. I can't say when, but I can say we will get there. Thank you. I submit.
Thank you very, very, very much, PS.
I can take on another one question.
Okay.
If there is an answer.
Savia, coordination.
Okay.
Savia, are you there?
Yes, I am.
Any hands for PS local government before we let him off?
PS, thank you so much for taking off time to address us. I'm looking out for hands. I do not seem to see any hands coming through. But maybe from the team here at the college, we want to congratulate you for driving the sector and making sure you get to the sector status, because I think we've seen you come that far, and we are glad that you managed to achieve that. And we have hope that we should be able to move forward. There's invaluable input we are getting from your sector. Thank you very much. But
Thank you.
I don't see any other hands. So I think, like PS said, she lets you off the hook.
Yeah, thank you very much and all the best.
Thank you.
PS, we are looking forward to fireworks in Jinja tomorrow. Is it tomorrow?
Tomorrow, Jinja.
Jinja. And
tomorrow,
Savia is there right now.
Yes, yes. And then on Thursday, we shall be in Mbare and Mbarara and Guru, and Friday we shall be in Arua and Fort Potro and Masaka.
Thank you very much.
Very, very much. That shows you how much the public servant has worked in order to see this historical event of the first other cities taking shape in Uganda. Thank you very much. PS, all the best.
Thank you.
To you, Savi.
Thank you very much, Chairperson and PS. Ladies and gentlemen, you heard it all from the presentation on the status of the human resource. You have seen what our service looks like today in terms of the statistics. You have seen the challenges that we are facing. You have heard what we are planning to do. You have heard the requirements for us to reposition. You also have heard the invaluable input of the two sectors, the health sector and the education sector. I really think they have done a great job. They are doing a great job. The challenges are there, but we believe that with our support, the collaborative effort that has been highlighted ever since we started this morning should be able to take these, to support these sectors, to support the clients, to support the citizens. So I think it is important that if there are any questions which we think are pertinent for us to address to these two sectors, a local government we have had, if there are any issues, I think the PS, our PS will be able to communicate with the PS local government. But short of that, let's have any comments, questions for the health sector, education sector, and the status of HR in the public service today. Ladies and gentlemen, are you there? Have you already broken into a virtual lunch?
I have a question for Dr. Biachika.
Okay.
The public has been on our case about the implementation of the health insurance policy. When does that come? When is it going to happen?
Yes, I think Dr. Biachika, we don't have any other questions, so you can pick that up immediately. Hold on, I have a physical hand. Someone is taking the advantage of being close to me. So Kenneth, your question or comment?
Thank you, Savia. It's both a comment, but probably will translate into a question. And I'm particularly referring to the HR statistics, the public service HR statistics. And somebody, I think, pointed it out in the chat section, noting the gender disparity among the pensioners. And but before even going to the pensioners, I think one of the things that stood out in Mr. Algembe's presentation is the disproportionate numbers of men and women in the public service. And I think in his statistics, women are at about 36% and the men at about 62%. And I think that one of the gifts we can give the public service is to try and bring parity between the women and the men. And the imbalance that we see in the pension, among the pensioners is specifically because already the ground is not level. The entire ratio between men and women in the country is disproportionate. And we therefore need to come up with a deliberate strategy or initiative to bring in as many women as possible. Because if we leave it the way it is, it doesn't matter. It will take probably around 50 years or 30 years before the women can catch up in terms of numbers. So if you look at the graduates through primary to post-primary, secondary, tertiary, and university, if it's out of 100 graduates, probably 90 or 80% are going to be men. So even if you have women who are competent, who are willing to work in the public service, they're already outcompeted before they can even begin the race. So the idea that there is merit in the recruitment in the public service already loses ground because the ground itself is not level. So my question is therefore, why is it so hard for us to change the recruitment requirements or policy in the public service so that we can be able to bridge the gap between men and women in the public service and begin to see more women holding decision-making positions and technical positions as opposed to the traditional jobs they have been holding of office attendant, tea girl, cleaner, and secretary. I think that we have a good opportunity here to actually create policy change and prepare the service for the future, so that we are able to be more effective. I thank you.
Okay, thank you very much, Kenneth. I still do not see a hand, but maybe at this point in time, I would personally like to take the opportunity to refer back to Mr. Mugenyi. When he was highlighting some of the challenges that they have faced in the education sector, he did indicate that the private institutions, the private schools have had their challenges. And one of them has been the paying of the teachers that are within that group of schools, the private schools. My question is, going forward, what is that supportive mechanism that the ministry has thought through and brought on board, which is going to support the private schools? I don't know, it may not necessarily be in terms of paying salary, because that may not be sustainable, but what is the support mechanism for these institutions? That didn't seem to come through in your key actions going forward. Thank you very much. Chair, back to you.
Thank you, Chair. I think we can start with those responses from, if we can get those responses from Dr. Biachika and then Mr. Cleophas Mugenyi. Yes, Dr. Biachika?
Thank you very much, PS, for that question. And as you are aware, implementation of the health insurance scheme, National Health Insurance Scheme, will require the law in place to support its implementation. So we as a Ministry of Health had the bill gazetted. It is before Parliament. There was a first reading in Parliament, and the Health Committee started the consultative meetings before the bill could be discussed officially in Parliament. So in the process, that is when we had the COVID coming up. So I would say it is still under the legislation process. We are waiting to get the outcome of that before the implementation can be kick off. Okay.
Yes, thank you very much.
You're welcome.
Yes, Savia, back to you to coordinate questions.
Madam PS, Mr. Mugenyi had not responded to his question.
Yes, can he respond? Mr. Mugenyi?
Thank you. Thank you very much, Savia, for the question. Ideally, we don't have any kind of support as of now, which we can provide to private schools. But the local governments have tried on their own to mobilize food to support teachers of private schools in urban areas. For example, Mnimasaka municipality, I think Ruengo and other places. But as you know, these are private institutions established by individuals, and basically the work of Minister of Education is to ensure adherence to policy, basic requirements and minimum standards. But as a ministry, there isn't any kind of support that we have put in place that can support the private institutions during this time. But under the World Bank grant, we do hope that we shall be able to support the private institutions with some facilities like hand washing facilities and sanitizers, as a way of supporting them to reopen to ensure that there's a continuity of learning. I beg you, sir, may thank you.
Thank you for that. Of course, we do appreciate that this took us by surprise. And it is obvious that that has never been part of a plan of government to support the private sector, private education sector for a long period of time. We did not see this coming, and we didn't think it would take this kind of route. But that said and done, there is one question from Grace Euchu, which I think I could take on, where she's asking, with the effect of COVID in almost all sectors of the world, do you think our jobs as civil servants will remain the same? That is a question for debate, but what I can say is that the jobs can't remain the same because we have, number one, besides the cost saving and the labeling of essential and non-essential, the remote working and all that has come up shows us that our jobs will definitely be redefined. And they'll be redefined, and there are a number of policies that will arise out of this worldwide, that the civil service will not be the same. So those are some of the areas that we need to look at where Dr. Kauzia was saying we need to be scientific prophets, to be foresighted and see what is it that might change. What is it that we can adopt in order to be resilient, regardless of whether a likely event such as this reoccurs or another one of a different magnitude, maybe bigger, comes up. Then, Mr. Cleophas, I hope you haven't, Mugenyi, I hope you haven't gone off. There is another question. How is the school curriculum being refined to ensure continuity of the high performance work culture that is being enabled to emerge now? That is from Pamela Elubu. Mr. Mugenyi, are you still there?
I'm available. Thank you very much. We have several curricula, so I don't know the particular curriculum is being referred to here, because I have a curriculum for pre-primary schools, primary, lower secondary, HSC. So which type of curriculum are we talking about here? That is my issue. Are we talking about the curriculum generally, or a curriculum for a specific section of our education system?
Chairperson, I wasn't able to see the update on my machine, but I was told Mrs. Elubu had her hand up earlier. So maybe at this point in time, I would like to request her to clarify to
She
Mr.
has
Mugenyi.
clarified.
So,
she
Madam,
has clarified.
I beg your pardon?
She has clarified.
Okay.
That, how is the school curriculum being refined to ensure continuity of the high performance work culture that is being enabled to emerge now generally. The lower secondary school curriculum has been revised to make it a competence-based curriculum, so that the learners are equipped with relevant knowledge and skills for the 21st century and places of work in a modern society. Of course, every institution has its own way of doing things. For example, in public service, we have the rewards and sanctions committees at various levels, where people who perform very well are rewarded, and possibly those who don't perform are sanctioned. So at school level, I think in most of the institutions, there is the culture of awarding of bursaries. There is also the culture of recognizing the high performing students. For example, in many district local governments, the political leadership work with the technical staff and the area MOPs, and almost in every district there's this culture of celebrating the PLE results where schools are recognized. For example, recently I was in Ruengo. So the best 5 schools in last year's PLE were awarded, with the first school being given 500,000, and then the 5th school getting 100,000. But we're also encouraging the teachers to use the appraisal system to ensure that they encourage the learners at classroom level to ensure that they may sustain and maintain the good performance while studying. I think as of now, that's what I can say. Thank you.
Thank you very much, Mr. Mugenyi. Madam PS, I think there was a question relating to the gender disparity, or the disparity between female male in terms of the service aggregation. I thought maybe that one would get back to you.
Thank you very much. I think Kenneth Atim answered that very well, that some of those disparities are right from the way our population is structured. And as you're aware, there has been a concerted effort by public universities to give some affirmative marks, additional points, affirmative action. And the affirmative action has also been emphasized by Equal Opportunities Commission and taken up by all service commissions. However, the disparities still remain. And I think when we focus on the pensioners, people in that retirement bracket, or those who retired, you note that the disparities were much bigger in the past. That is why it appears much larger among the pensioners than those who are serving. But even within those who are serving, you will note that in the security arm, the disparities are also bigger. There are more males than females. But then when it comes to the education sector, it's the other way around. I think because the education sector, the teaching is more conducive for the female gender, because there are biological roles that women have got to undertake, and they are best suited in that profession, because you know that the holidays are time for nurturing children, and so you have females taking longer in the education sector than any other sector of government. However, as government, there are policies in place to handle that, but it will take time before we see actual balancing of the two, because demographically it's not balanced, plus all the other factors. I think that is the way I would answer it.
Thank you very much, PS Chairperson. Maybe before I hand back to you for closure of this celebration, I wish to note that among the institutions that joined us later, we also had Success Africa, which is represented by Madame Pamela Elubu. So we want to thank her as well for having taken time off to join us. Madame PS, as I hand over back to you for the closing ceremony, I just wanted to note that key among the takeaways that you have highlighted and that have come through is the need for us to have a service that is hinged on values that are grown right from the family level, right through into school, and the national values. So the issues of pre-service and in-service capacity development have come through. The effective utilization of human capital to address the issues of wastage, measurement of productivity, which you clearly highlighted, the need for us to understand what our DNA should look like in terms of the role that we are called to play, and the fundamental value of humanness. The issue of partnerships, collaborative partnerships across all entities of government and the private sector, the need for outreach, the need for continuous sharing of information, and also the need to facilitate the public officer to be able to perform his duty or her duty. I think those have distinctively come out on the part of us who've been doing a bit of the moderation process. But with that, Chairperson and Permanent Secretary, I wish to hand back the podium to you for purposes of closing off this celebration. But on behalf of the technical team this side, we want to thank you so much for your leadership into celebrating this day, for the partners that have been with us, and above all, the participants that have taken off time to be with us. So, Chairperson, I hand back to you for the closing. Thank you so much.
Thank you very much, Madame Savia Mgwanya, Commissioner, Civil Service College. Indeed, this has been a very memorable and remarkable celebration that we did not know how we would pull it off, but it has been such a great success. In my capacity as delegatee of the head of public service and permanent secretary. I'd like to thank you all most sincerely for participating in this webinar that has been our means of celebrating the Africa Public Service Day. My salutations go out to each and every public servant who has performed with all the diligence and due care during the last 1 year since the previous celebrations of the Africa Public Service Day. It is with great pleasure that I say I'm proud of all of you. To our sector presenters, you have provided us with very informative insights into the depth of service delivery as far as interventions into the management of eventualities arising out of COVID-19 are concerned. Dr. Sarah Biachika, Mr. Cleophas Mugeni, and of course, my colleague, PS Local Government. I can only say thank you. You have really informed us very well. You have educated us and made us proud that we are indeed celebrating the Public Service Day. It is because of your resilience, in spite of all the challenges, that we are here and that our nation has been applauded for having ably managed a world pandemic. It is also because of your efforts that Uganda can hold its head high and that our people can move with the comfort of the security of health systems, even when they have challenges, because of all the effort that you have put in. It is our concerted effort and negotiations that we have put in place that will ensure that there will be continuity in service delivery. The Ministry of Public Service hereby assures you of its most relentless pursuit in ensuring that its mandate of enabling the public servant have the best possible human resource policies and practice that can provide the most conducive workplace environment. This is our pledge, and we hope with all things possible, we'll be able to achieve it. You'll note that some of what we'd have loved to achieve will be undertaken in the medium term, while the rest will take a little longer. In particular emphasis, I'd like to assure you that we'll continue all efforts and negotiations to implement the pay enhancement plan, most especially after the upcoming elections. It is with this commitment of government that I hereby encourage you to soldier on. I know the road will not be easy, as you know, most especially with the economic shocks that we have just experienced, but we will succeed till the end. It is also my considered view that with your perseverance and support, the cause that we have been pursuing for so long of pay enhancement will be attained. I just request you to continue with resilience, that we both strive to attain our national development goals as we serve this nation. On this note, I take the honor and privilege of thanking you, all our facilitators, right from our Minister of State, who has provided very good leadership, and of course the Senior Minister. I thank Dr. John Mary Kauzia once again from UNDESA, the Private Sector Foundation, Mr. Gideon Badagawa, Mr. Edward Walugembe, Commissioner M&E, Policy and Planning, Ministry of Public Service. I thank you, Mr. Cleophas Mugeni from Ministry of Education and Sports, and Dr. Sarah Biachika from Ministry of Health. Then I also thank all participants and those whom I particularly noted because I know the institutions from Ministry of Foreign Affairs, Uganda Police, from Gulu, from Success Africa, from Ministry of Justice and Constitutional Affairs, from Ministry of Agriculture, the staff of Ministry of Public Service, and all other participants who are on this webinar. I'd like to inform you that we registered over 57 participants, which is no mean achievement. Last but not least, I'd like to thank the organizing team, the moderator, Ms. Savia Mugwanya, Commissioner, Civil Service College, Mr. Patrick Mundua, the Assistant Commissioner, IT, and all your teams that have ably worked out all the technical details. I'd also like to thank the media that has covered this event. I wish you all a blessed day and a fruitful work year. I thank you for listening to me, and I hereby close this webinar, as I say, for God and my country. And someone lead the cheering. I thank you very, very much. Can you unmute your mics and someone lead the cheer?
Mr. Chiria is around.
Mr. Chiria can take over.
Asante sana.
Thank you very much. God bless you.
Thank you too.
Thank you. Okay, bye.
Bye.
Thank you. Thank you. Thanks very much.
Adam's number. Adam's number, yeah.
Yes, sir. Speaking without listening, okay. Some camera. I think if you come down here.